I he's good. He helps me. He helps me with that. Okay. Well, good morning. I am beyond thrilled to see you today. What was the song you sang for me, Andrea?
Oh, hey, I'm on vacation every single day because I love my occupation.
She sang that for me when I came in, and that is really my place right now in life. I love getting to be here with you all so much. So, and I might feel differently if you all weren't so amazing and wonderful. So thank you for all the good energy and attention and everything else you bring to it. I do have a reminder for you, a request. You might have heard Sam saying, some of you probably know what I'm going to say, but just a reminder, be here ready to go at 7. It's really important. And then when you're teaching, it's really important that you're mindful of your time. And this is really just the practice of asteya, right? Like non-stealing. And I know we don't mean to, and so I'm saying this from a compassionate place, but also a firm place, because both we got to do the things we got to do, right? So that said, we are going to do a tiny bit of movement right now. It's nothing painful. You don't have to move anything off your mats. It might be hard with oatmeal or whatever in your hand, but you can come back to it in about 2 minutes. Let's do our little vayu, Simon says, just to get moving. And we'll see if we remember the vayus. Oh, real quick, what are vayus?
Reactions of energy.
Yeah. Oh, nice. I'm reading. Well, anyhow, I'm trying not to do too many side quests today. Okay, go ahead and stand up. Okay. Let's see if we remember what is a good motion for apana. Apana is our yeah, and I don't remember what we did in the past. We've done forward folds. Some people are like squatting down. So that you get to choose. It's to choose your own adventure to a degree. Find your apana. That's that downward moving energy. Good. Now samana, that comes in from the outside toward the middle. The third chakra's there. So what's a good movement? You can do this. Eagle, I think, is especially that like little crunched up eagle, but we're going to move fast, so might be hard to do. Okay, what's a good one for prana? Ooh, yeah, Tiffany, that's good. It's that up and open feeling, right? Like that forward and opening the chest kind of motion. So cactus arms are just open arms with the chest lifted. All right, Udana. Amy was on it. She was like, I'm ready. I'm waiting for Udana. Right? And this one has lots of chakras that live in the same home. Last but not least, what one goes from the center outward? Woo, we're doing a jump. Viana from center moving outward. And I was thinking about it the other day. Really, all the chakras are Viana. Oh yeah, you did the sunflower. Okay. Well, let's see. You again choose your own adventure. Just do some movement that correlates. You know, if I say Viana, you're not going to be like, oh, your yoga adventure. All right. Udana. All right. Up. Yeah, there you go, Lori. It's hard. You don't have the advantage of I'm going to turn this around so you do what they're doing and look at your neighbors if you're not sure. Okay, so there's lots of pressure on you three.
I'm gonna fix your careful of your top block.
Thank you. I like to live on the edge. All right, Apana. Move safely, I mean, of course, right? Samana. Yeah, curl up toward the center, Viana.
Oh yeah, I'm gonna do this.
Samana. Viana. Samana. Udana. Oh, see, I got tricky there. You can tell I used to teach 5th grade. Prana. Yeah, chest up and open somehow. Udana. Apana. Samana. Udana. Viana. Okay, now take any other movements you need to get set up for the next, ooh, till about 11:15. Of course, you know you can get up and move at any time. Take breaks if you need them. Okay. So, here's what we're doing today. We're doing a little thing called yoga for emotional and mental well-being, setting you up to work with your client. By the end of today, well, let me just tell you what the day looks like. We'll do our review. We'll review the koshas and kind of some stuff that we did last time. So a little bit of a review. We will, what else are we doing? We're doing, we'll look at our objectives so that we all kind of know what we're doing and why, and then we'll do a big picture setup of the whole thing. So I'm going to start with the whole idea. We'll break it down into bits later. So just so you know, so your brain can relax and know, okay, I'll get the real nitty gritty details later, but we'll start with kind of a literally, how do you fill out this form? What are you going to have in front of you? What are you going to look at? What are you going to talk to your mentor about? What are you going to do when you meet your client? Like, what's that going to be like? How are you going to do the follow-up? So it's just, we're really going to go through the steps. Okay. And then at that point, I believe we'll be taking a break. Unless it goes like last year. I was watching last year's video and I was like, oh, talk about time management. They had so many good questions though. We'll take a break. We'll come back. We will look at an example of someone I worked with earlier on who had anxiety and what we came up with. And I'm also going to show you what I would do differently now. So I want you to see kind of what worked and why we do certain things the way we do now. Just a few little things. Then in groups, you'll do some practices of this, where you come up with, all we're doing really is coming up with little mini sadhanas for people to support them. So that's our goal. We talked about values. Any questions on values? Does that help you kind of remember what they are and what they do? Okay, because that'll be something you'll look out for your client and consider is their values. Another thing you'll look at and consider before I get into koshas is their gunas. So what are our 3 gunas? Tamas, Rajas, Sattva. And you remember the feel, like last month when we did the Gita, we started and I had you like get tamasic and heavy, and then we got kind of rajasic and then sattvic. So just that sensation and the feelings and qualities will be important for you to be able to tap into. And then of course, really the heart of it all is the koshas. I feel like the rest of it is supportive, but it's really the koshas where that gives us a really good foundation for working with people on all levels. So first off, what are the koshas? Excuse me. Oh, I'm so sorry. Let me be more clear. What is a kosha? What does it mean? Sheath. Yeah, there you go. So it is the layers that basically cover our Atman, our true and abiding nature, whatever word you want to use for that, the self, capital S self. And there's several layers. What is the most dense and heavy? You can look at your notes. Annamaya. Yeah, Annamaya, the food sheath. And so this one, our main, when we're looking at it, and when we had our yoga toolbox, we had Annamaya Kosha, and we wrote down a lot of real physical type practices. We wrote asana. We wrote different kinds of asana practices, from yin to hot to who knows what all's out there anymore. To also just, doing gentle versus more firm, those kinds of things. Okay, what is the next As we get more subtle, what do we have next? Pranamaya. And this is where our vayus live, because our whole, really, when we think of that energy body, the chakras, how prana flows through the system, the vayus pushing it through the nadis. This is what we're talking about. It's the kind of the glue between and the communicator between body and mind and the more even more subtle stuff. What's a way we work with this one? Yeah, breath work, prana, pranayama, prana. Kriyas, all kinds of things can work on it, but that's what we're mostly probably going to look at. Although anything that affects kind of our energy levels and things like that. All right, what is next? Manomaya. Was that you, Sebastian? It was. That's quick. Manomaya is the mind. So this is this is all the stuff, but it's the lower mind, so to speak. It's the heavier, denser mind. So this is thoughts, feelings, education, things like that. That's all, memories, all of that's here. This is through working with words generally, which would be mantra. We could also put maybe journaling here. We could put like, think words, think sankalpa, that kind of stuff. But also remember, like with sankalpa, we want them to feel it too. It's important to get the feeling layer, not just the words. And it's the same really with mantra. We want to feel when we do any kind of mantra. So we want to be sure when we're working with this kosha that we're working with thoughts, but also the feelings, because it's really, we have a thought, the feelings with it trigger a whole wave of things that happens in the brain and neuropeptides, and then the body is like, okay, let me do what you're saying. And so we want to really work on both of those. All right, what's next? Yeah, and I'm so happy you tried saying that. It's a tough one. You could just say Vijnana. It can be Vijnana or Vijnana. J is always J is just never J. It's like technically it's not always a G. No. But it's not a sh. Yeah. And in this case, I don't want to get into it too much, but it's not, this is a weird word because of the JNA. So it is treated a little differently than the normal J. Is all I'll say, but it's not the j. Even though the j is a pretty sound, it just doesn't exist in Sanskrit. And this is the wisdom. This is when if we remember our Prakriti chart, right? We have Purusha, Prakriti. The first step, we have Buddhi, mind, or Mahat. And so this is where just that deep sense of integrity, of a sense of dharma, a sense of, and when I say right and wrong, I don't mean in a society says it this way. That would be more of Manomaya. This is like that deep truth knowing part of self that has discernment and can really look at the big picture and make wise choices and decisions. What did we use for
Like
this?
your Jiminy.
Oh, what's that?
I said like your Jiminy Cricket.
It is your Jiminy Cricket. Oh, I need that in the manual, a little Jiminy Cricket on the on the chart.
Meditation.
Yeah, meditation's a really, I mean, that is a great way to get to it. I do think there's some reflective practices that can ultimately add to it, like again, the journaling, Pratipaksha Bhavana, things like that, like considering what we're doing and how how those choices affect everything. That kind of stuff kind of links the Buddhi mind with the or pardon me, the Vijnana Maya Kosha with the Mano Maya, and gets them communicating with each other when we do these practices. All right, what's the last sheath, the most subtle sheath? Anandamaya Kosha, the joy or bliss sheath. And this is devotional practices. But that won't work for some people. And so it's also just doing what we can to get them to connect to that sense of joy and love for life, gratitude, all of these really higher compassion. It might be charity work. It might be, but it's from a place of truly, not out of, I have to, but out of, like, it's from this place, right? Of, letting go of the fruits of the actions and doing it.
Could this be what they love to do, like this mountain biking, this is their bliss, their joy, and they do that to the.
To an extent, yeah. Yeah, here's the tricky thing, is that is, to an extent, anything that brings joy. We want to try to connect them a little with their Satchitananda here, their Atman. And so we want to get a more, because what happens if they break their leg? And they can't do that anymore? Then they're cut off from that joy. So I'm not saying don't do it. I'm just saying I don't know that I'd put it in this one. And you could say that with all of them. Like if you said, well, spending time with family could go here, it could. But then what happens if there's a falling out and they're not with their family? So we could really go down that rabbit hole. I just want to be, what I want to say is be careful with having it, that sense of joy from mountain biking. Let them connect with that on a deeper way and bring it out of their mountain biking, off of the bike and into the world, like connect with it there, but then bring it out. That's what we want to do with any of these things, is connect, but bring it out. So it's not just, I'm only happy when I'm, I don't know, with my kids, or I'm only happy when I'm mountain biking, or I'm only, right? Does that make sense, Amy?
Yeah, I just, was just thinking about private client, like, are they doing the joyful, blissful things for themselves? What might that look like? Is that their passion in life, like they love to bike? Or it sounds like maybe it's a higher devotional practice. It could be meditation.
Here's what I mean to say is I think it connects us with that, but we don't want to get them to a place where they grasp to that, to where it's the only thing that can bring them joy, because it will go away.
Mhm.
Either they're gonna get COVID and miss it for 2 weeks. I mean, it could be temporarily gone, or something happens, or someday they die. And so to some extent, we need to, as yoga educators, keep an eye, even when we're saying go mountain biking and connect with that joy, we want to keep an eye on the bigger picture. So we want to turn it into a practice where it's like, where is that joy at? Where do you feel it in your body? How can you access that at other times? Does that make sense?
Yeah, so that would then be looking at their maybe thoughts or their meditations, where they're directing their energy and what they do here. Like if you're looking at it from a private client perspective, do they have a non?
Right. I'm trying to give it to you. I'm not sure what I'm not
Yeah.
saying correctly. Can anyone support me? Does anyone know what
What
I'm?
kind of practice to give to your private client?
Exactly what I just said.
So,
Go mountain biking, notice where it's at in your
Oh.
body, take that joy. Where can you apply it off the, yeah,
okay.
that's what I mean to say. Yeah, sorry, I somehow,
So take that feeling and see where you can apply it
Apply it.
elsewhere. That way you have more tools to bring about that feeling of joy.
yeah, it needs to not just be, what we want to do is, yes, they can get to it conditionally, which would be the mountain biking. But then we want to give them a little more so that it starts to become unconditional.
Mhm.
That's what Anandamaya is. But we get to it through what you're saying is what brings them joy.
It's like knowing that you have a blue sky, even though it's a cloudy day sometimes, like keeping that sense of underlying bliss. It's always going to be there, even if you can't see it. And that in and of itself is comforting.
Yeah, absolutely. It's, does anyone know about the Heart Math Institute? Have I talked to you about this, or do you know about it? Yeah, it's cool. It's about heart rate variance and getting into coherence. But one of the things you do is you do breathing into the heart with an elevated emotional state, compassion, gratitude, love, things like that. And it actually changes the heart rate. It will change it. I have one of their little things you hook to your ear and it monitors you. It's pretty cool. So you can actually learn to create, but it is just that's what it's doing, is teaching you to tap into Anandamaya. Is just this, it needs to become a practice, not just, and that's what we want to help with, that would be a little different than like a life coach or someone, is we want to be like, yes, do your mountain biking, and also how can you connect with that feeling otherwise? Yeah.
What's the institute called?
Heart Math Institute. Heart Math, yeah.
I just think it's so important what you said about having people identify more deeply than just with an activity. And I guess I just see all my patients coming getting new cancer diagnosis, and now they can no longer do their favorite activities. And where do they go for hope in their darkest moment, because they can't go get on their mountain bike? So I just think that that transcends a lot of things, and that's such an important piece of this. Like,
Yeah.
how can you find meaning beyond your identity almost?
Yeah, beyond the things you do, because that's the things you do are Manamaya, Pranamaya, and Anandamaya. Hopefully, maybe guided by Vijnana a little bit with some wisdom, but like we want to get into that stuff that's beyond that if we can, but it is a backdoor into it. So it's not wrong. It's just, let's give them some tools to stretch that experience. Yeah, Ryan.
Well, like I feel like you think about this in terms of like grief. Cause you're sitting there going like, all of these activities that we do, they're great, but like if you lose something, you get a cancer diagnosis, you lose a loved one. What are you gonna do with that feeling? Like, how do you, like, you want to be able to transmute that into a place where it's like okay, like when you feel grief, but you can be then joyful through that experience. Like you're sad and you're like, that's shitty.
Yeah.
But then you're like, but that's how much I love somebody. That's why
Yeah.
it's that way. And like to be able to do that, like not having the aversion or the yum yucking, and being able to like actually just be joyful, even when things are kind of shitty.
Right. Yeah. That's so well said. When we're down in the muck,
Yeah.
like, can we still, even when we're in the muckiest muck of life, which I think tends to be grief, and it might be grief for what we had through a cancer diagnosis, but it also might be like you and I have both lost parents in the last few years, and I know other people have had losses in here too. And over your life you have, and it doesn't mean you don't feel that stuff. It means you feel it, and there's also this.
It's like you feel it and you know you're going to be resilient to it.
Yeah, and part of that means is surrendering to it too, is being, not avoiding it. And really allowing yourself to have the experience, but also as you go through it more, there comes a point, and you start earlier, just with grief, like there is this process, because this is a module in which you might have someone grieving, or you will probably run across it if you work with people. And it's certainly something to be felt and experienced and gone through. And in the earlier days, it's it's hard, but then slowly those practices, those little bits, each time you have that moment of absolute grief bringing you down to your knees, but also feeling that deep, 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 deep love, the more you do that, the more the shift does start to happen. And then it doesn't mean the grief ever goes away. It just changes. I do want to add, while we're just talking about grief, do I want to add that now? No, I'll come back to that. Okay. Anything else right now on koshas? We'll get to talk about them quite a bit more. as we go through. Um, I want to, just a reminder, just not to use the word therapy. I don't think you would, but some other words are consultation, education, yoga educator, yoga teaching, yoga teacher. And so much more than just keeping Yoga Alliance happy, because I frankly, it's not a huge concern in my life, but I do want to keep you aware of, they don't like you using that term, but also just the word therapies, it implies a lot about healing. And that's not really, we're here to give some tools, keep it simple, and to alleviate some suffering. I also want to encourage you and let you know that you will feel, because you've all been doing yoga, you might feel like, oh, this is so little, and so how's this going to do anything? And I think you might be really surprised and encouraged by how the little yoga really does work. Right? So you can like get out of your own way and just be like, oh yeah, the yoga does work. Missy Romero interned with me last year for the Gita, and somehow it came up in the Gita talk about this. And she's like, it's so intimidating at first, and you also kind of downplay in your mind, like the different tools. You're kind of like, yeah, how much is that going to work? How much can belly breathing work? But then you give people these little things, and it's just like, if you change that trajectory by just a little, yeah, Amy.
I have just given one thing to my clients in chronic aquatic therapy. I just look at their breath pattern. And I just say, let's focus on the belly breath. Maybe it's an extra breath at the top that pulled up high and then back down. It's one exercise. And I can't believe how it's changed people's lives or body. Just not one thing.
That's so wonderful.
Like that might not even be really a yoga thing. Like we might have known about practice, but just think what 5 of these practices put together. Let's just, so I don't know, that's just really cool and invigorating.
That's awesome.
Yeah.
I love that. Thank you for sharing that and that encouragement too. Like, it's, you're not going to break anyone. And sometimes we go into this, and I think the idea of yoga therapy or healing, it puts too much pressure on you. Like, you're Adam's supposed to go in and fix Sebastian if Sebastian's his client. No, we were not fixing anyone. We're not healing anyone. We're just like, here is what yoga would suggest you do. Try it. So try to take some of that pressure off of yourself. And I just think it'll be a lot more fun, because this actually is really rewarding and fun and enjoyable. This is a really enjoyable thing, or it has the potential to be. Remember that, and part of this is yoga is the art of personal responsibility. So what I mean and what I don't mean. What I don't mean is, of course, if someone comes in and they've had a cancer diagnosis, it's not going to be like, well, I mean, you all know this, but just to reiterate, like, we don't even want to give that vibe of, well, just do this, this, and this, and it's on you, and or anything else. I think sometimes with the more emotional stuff in our culture, that it can be even more like, just get yourself out of bed, do your pranayama, do pulling prana in the morning, and you shouldn't have depression or whatever. So be careful of anything that has that texture to it when you're talking to your client, but only they can do the practices. So, and only they can work through their own karma. One question really worth asking is, what are you willing to do to heal? Because there may be things that they're just not actually willing to do, even though they want to. The want to do the other things that get in the way of healing is bigger than the want to heal. Yeah.
Another question that I like to ask is like, I think this one could be more triggering, so I think I like the way you said it better, but like, are you willing to give up what's making you sick?
Yeah. I mean, it's the same, it's
Same
the
thing.
exact same idea. Yeah. And that one, the version I just said came from Shanti Shanti. You get to see her soon. That'll be fun. And I think that that's important to remember. You are giving information and ideas. And that's it. So just cut yourself off from any, entanglement in the drama of, oh my gosh, is this gonna help them or not? Try to. Yeah, Kathy.
I like thinking about it, like when you're focusing on curing and healing a person versus what we're doing is, just offering suggestions. It's just a good way to help build upon the strengths that they already have
Mhm.
instead of focusing on like the weaknesses that, or disease,
Mhm.
I like the focusing on the strengths part and help building that up.
Yeah, absolutely. Thank you. Did you all hear Kathy okay? Just focusing on the strengths and building that up. Yeah, and really, I don't know if I said this last time, but we don't even really care about what diagnosis they got from their doctor or their mental healthcare worker. We don't care. That's just, again, a doorway in, right? It's like, okay, it's anxiety, but now I'm gonna let that go. Cause if I sit here and think I'm gonna take care of your anxiety, it becomes a whole other thing. Instead, I'm gonna be like, okay, let's look at the koshas, let's look at the vayus and then have some trust that that will take care of, to whatever degree, that diagnosis or surrounding things around it that might be driving that diagnosis. I would like you, if I want to add 2 things to your toolbox before I forget. So this is we're diverging a little bit, and then we'll get into what's next. But I don't believe we added pulling prana or breath of joy. Did we do those? We did do breath of joy. Did we do pulling prana?
No.
Okay. So add that one, because I think that one's really, that's a good one. I also would like you to add, and this can be either in that like other practices. It's just a tool to remember, and it could fall under any of them, but it's the power of visualization. And here's what I mean by this. They've done studies where they have had people visualize, but not actually flex their bicep. The bicep grows in trials against, and they've done it with several muscles. In Kundalini yoga, it's considered more powerful to actually visualize your practice than do it. Because what is the most subtle, what's more subtle, what you're seeing in your mind or what you're doing with your body? Yeah, so it actually is getting to more subtle levels. It's just our brains are like, I gotta feel it for it to be real. It's not real, right? So I bring this up because if you ever are working with someone who can't do a practice for whatever reason, they have a physical limitation, you can have them imagine doing it.
Can I say something there?
Please.
For our adaptive, I'm doing an internship with Morgan for adaptive.
Uh-huh.
And one of the students has cerebral palsy and she doesn't have a lot of movement, well, lots of places, but specifically in her feet for right now. And we were working on spreading our toes. And we just said, like, if your toes won't spread, imagine spreading your toes. And also, like, I would take my thumb and just spread my thumbs away, and as if I were spreading your toes.
Uh-huh.
It helps a lot, like, it helps so much.
Great. That's a great example. Thank you. Yeah, it's huge. I'm so glad you've had that experience with it. In Ashtanga yoga, the practitioners, and not Ashtanga meaning Patanjali's, but meaning Patabi Joyce, who taught a very systemized style of vinyasa yoga. But you do your yoga 6 days a week, come hell or high water. And what that means, a lot of them push through even when they shouldn't physically, but those who are wise and say they're sick, instead they actually visualize it on that day. So they still go through it, but they visualize it.
I'll visualize doing core any day.
Yeah, right.
I'm doing plank.
I really, do a plank. I am, what?
And even we visualize playing. And
Yeah.
I mean, that actually builds muscle memory. Neuroplasticity.
Yeah.
There's gonna be a pathway, but wants to integrate your body, wants to move. So your mind and your whole human body is so crazy smart. It will figure out a way.
And this is why the body is birthed out of the mind. We've talked about that, but that's exactly the Prakriti involutes and evolutes. What's happening in the mind, in the samskaras, in the memories create emotional states that then the body has a reaction. The body produces hormones, the body produces cortisol, the body, whatever. And so we are constantly, visualizations I just can't say enough about it. And so if you have someone who just, or even if here's what I want to say about grief. It'll be tempting to give heart openers to people who are grieving. Because what vayu do you think is especially strong during grief? Samana. It's a coming in. And yes, eventually it needs to be opened back up, but if someone, especially in the early days or not in early days, but it's just in a deep struggle with it, a visualization of doing heart openers is a lot sweeter and more gentle than being like, okay, wheel 5 times in the morning, every morning. You wouldn't do that, but I like to give silly examples so you get what I mean.
So you would have to visualize stuff like
Yep.
that?
Yep. And probably just even depending on how heavy, and depending on how heavy it is, it might even be it just very gentle, like a visualizing very gentle ones.
Could you give a client like that smaller back bends, like just a little practice the arms and Sunday kind of thing and work them up to?
Yeah, that's really good thinking. You can do little back bends for those clients as long. And if it causes a little discomfort, honestly, to some extent, all of this is going to cause a little discomfort because we're doing the different thing. We're trying to strengthen what has become weak in the vayus. And so if they can do just gentle, like cactus arms, that's great. So, and that's why it's important to have conversations and to try things with them. You won't just be like, hand them a list of stuff and then walk away. Try not to do that. Okay. I'm going to very quickly go through your learning objectives. They are, what are they? They're in this beginning, this emotional yoga they're 4.1, if you want to follow along, yoga for mental and emotional well-being. Because there's a couple of points I want to make. Learners, that's you, will leave with the basic understanding of these conditions, but again, then you let the condition go and you just start looking at the koshas. You'll learn how to apply the yogic strategies you already have with these conditions and gain a few new ones. You'll begin to synthesize knowledge of the koshas, vayus, and gunas into an integrated system for understanding dis-ease from a yogic perspective. You'll develop and practice critical thinking skills so you can assess various client conditions from a yogic perspective. So I want to say this. You don't have to the thing about the diagnosis is sometimes we think, I don't know much about that. How can I work with this person? If you use critical thinking skills and put it through what we're going to do today, you can give them something that's going to be safe for them. Now, when it gets into like physical injuries and things like that, you'll want to, do your fair share of work. Or if they have, like say addiction, if they are like in the throes of it, it might not be the right time, but it might be. So there are times where if it pushes too much, or you're like, someone's like, well, I have 3 herniated discs and I haven't gone to a doctor and everything hurts and I've been in, I would feel comfortable working with that person. You might not, you might say, okay. Or I would say, and also go talk to an expert or let me refer you. That's beyond, you're allowed to say and should say, this is beyond the scope of what I do. But in general, this is going to give you those critical thinking skills and a tool that you can use so that you can really feel confident and comfortable that you are doing things for people that will support them. Part of too, why I think this work's important is even if you're sitting here going, but I never want to work with people individually, life has different ideas for you. Do you have family members who are like, you're a yoga teacher now? What can I do about my back? Like my next door neighbor on one side, we have a chain link fence on one side, so I see him all the time. And I'm always giving him little mini yoga therapy sessions because he does metal and woodwork and it's been so hard on his body. So that's just what life has planned for me. I don't have the option of being like, no. So this is a way to just, and also, by the way, the client I use this with the most is this one. So, you will inevitably in life, you will have setbacks physically, mentally, emotionally, things that cause discomfort or suffering. And why not attend to yourself with the yoga?
Is it, like, you can't do the whole time, because you don't want to be a meat monster, but like, is it good to like, on occasion be like, I also went through this, and these are the things that help me, this is what yoga.
Oh, when you're talking to the person?
Yeah.
Get a feel for it. And how appropriate it is or not, if you should share your own experience. I think it can be helpful. I also will tell you, it's a fine line. I had actually, after my mom died, I went to a grief therapist who talked more about her mom's death. And I really felt for her, but it turned into the situation was inverted.
Her processing.
Mhm. And I've had, so we just have to, there's just a line. But it's also okay to share if you've had success because it might, gosh, if that elevates their attitude about it, that's great. Yeah.
I think Sam Stang said this to me, when she was mentoring me, where she was like, remember to teach from the scar, not the wound.
Yes.
And I think that's really helpful, where it's just like, if you've done work and you feel healed, like, if you're still processing grief, like, they probably shouldn't talk about it.
Right.
Yeah.
Like,
I like that.
yeah. So
That's
I've always
a-
thought about
really
that.
good. Austin teaches that a lot too for, theming.
Yeah, that's what we were talking about.
Is that what you were talking about? Yeah,
It's
yeah.
something, well, something to be a part of the process, and that's what she would say.
Yeah, and it's perfect. This is a perfect place for that. Okay. Let's get into next. What is next? By the way, too, this is just a good even if you're like, I'm never going to use it for myself or anyone else. But what a great opportunity to synthesize, which is such a deep level of learning, all of these other things. Values, koshas, yoga practices. Like this is just going to deepen your relationship and knowledge of yoga. So next, like I said, we're going to go hold apart. Have the grid out, that matrix. I think that's the main thing, just to refer to. If you want to take notes right now, you can take notes.
Are you talking about the toolbox?
The blank intake questions in the matrix, just, or any of that. You can also look at, if you don't want a blank one, you can look at 4.3. And there's the one for anxiety. I just want you to visually have in front of you that grid so you can see what it looks like. You might right now want your kosha questions available. And like I said, those are I have an abbreviated version at 4.2. You might have better notes in what you did. last month, but you don't necessarily need those right now. All right. So let me just start with a big overview of the whole process. When you are going to get ready to, after this weekend, talk to your mentor, you will have in front of you, you'll take your intake form from your client. So you're just gonna put all the stuff where would have it all in paper because I couldn't do it all on digitally. That would be hard on my brain, but however you do it. Hi, Morgan. You'll have your intake form from your client. You'll have some version of this grid that I'd print out the blank one and write notes, but whatever you want to do. You will have those COSHA questions available and this little, if you look at 4.2, there's questions for the COSHAs. There's a little rating system for the values from 0 to 5. There's some reminders on gunas. Don't worry about chakras and doshas. We're not really going to get into those. And then this point A to point B. So that 4.2 can be helpful, or if you prefer, take out your other COSHA notes.
So you know those questions are on that matrix form in front of the grid. That's all I'm saying.
Yeah,
They are.
they're on there too. Yeah, that's what these intake questions, that's what I mean. Yeah. Thank you. Thank you. And if you really, but you came up with some great questions, so I don't think it hurts to have out your brainstorm from last month too, when we wrote questions to assess under the COSHAs. So you'll have this all in front of you. And your job is to basically bring it all together into something. And you do it by putting it through. We're going to talk about in general how to fill out this grid. We'll get into more detail in a little bit, but I just want to, right now, here's your to-do list. So you'll have, can I erase this? We all good? I'll write in black. Hopefully that'll show up better for everyone. My cord wouldn't plug into the extension cord, so now I'm sitting on my cord and I'm probably gonna keep pulling it out of the wall. All right, so what's on the left-hand side? What does it say? Of that, yeah, COSHA notes. I'm gonna write it this way. You know it's an SH sound. And what's on the other side? Okay, practices to consider. This is important because it just means you're gonna write down anything and everything that you think might work. So it starts with what one? Anamaya, right? And so you'll look at the intake form. You'll look at those Anamaya questions, and then you're just gonna write some notes here. So it could be anything that shows up. If they say they have pain in their left knee, or that their low back hurts, or that they don't have, what, I don't know, anything you think goes here. Now, remember this. Your brain may want you to get nitpicky, because you might be like, oh, but should that go in pranamaya? I think these two, it can be hard, and same with them when we get into mono and vijnana. As long as you're covering it all, remember, it doesn't really matter how you break it up as long as you're considering all of it, okay? This is just a way to make sure nothing slipping through the cracks. So you'll look at those questions for Anamaya, and then, oh, I forgot to tell you, have your yoga toolbox out too. Because remember, it's arranged just like this. So you're going to use that to help you brainstorm as many ideas as you can. And I mean, like, don't limit yourself. Don't let that critical brain come in right here. Just write down, squish them in there, as many ideas as you can that you think might be supportive. And you'll go down and you'll just do that for each one. So when you come to the end of koshas, you're going to have quite a list of things on this side. Right? I mean, can you imagine, like, just doing that? It might be like, whoa. Now, before we get into the values, just as far as the process of this, do you have questions?
So we should have that filled out before we meet with our mentor or what?
I'll let you know everything to have. I'll do that at the end of this part. I'll let you know, I'll give you a little list of, it'll be like, do this, 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 but yes, you are doing this before you meet with your mentor. Okay. Then let's get into the next section. What does it say?
I use most effective.
Yeah, so we have the values most affected. And you'll notice on that 4.2 where it has Kosha's values, it gives you a reminder of what each one does, and you're just gonna give it a little score. So for values, I'll write down Apana, and let's say I think it's I don't know, shout a number out at me.
4.
All right, I heard 3. Let's see how interesting this person winds up being. What's Samana?
2.
Okay, Prana,
2.
Udana.
5.
Okay, and Viana.
4.
Okay.
There's another 4.
Now, to make life easier, you are going to circle the low ones. And trust that this will all get sorted out. And I'm gonna call 1 and 2 a low. If you don't have any, if nothing winds up being a 1 or 2, I don't know, you're dealing with a supernatural person. Honestly, I've never, ever, ever run across that. You will get, I'll be surprised if it's not 2 categories also. So I'm like, okay, I'm just honing in on Samana and Prana. Interesting mix, but it's also not impossible. And so I'm gonna write down practices for Samana, as many as I can. Practices for Prana, as many as I can. So I've got all of these practices. Yeah, make sense so far?
For the 2 these, you said the 2. or
Yeah, because we're always gonna think about strengthening the weak ones.
What if there's like 3 or 4?
Then you write all those down. Yeah.
All that's weak, which is a 3 or less.
I would say a 1 or 2. Three's pretty good.
Okay.
Now, let's say if you have, I've never seen this though, Amy, if you have 4 of them that are a 1 or 2, pick your ones first. Those are like let's focus in, and those are your essential to do and the other are nice to do. I would still write the list for them kind of as a side note. But that's what I would focus on.
Now, I have another question.
Yeah.
So I know they did that intake form, and I'm sure if it's not clear on there, then it's the phone call that we'll have to really gauge more with the
Yeah,
values.
we'll talk more about
Yeah.
that. But also, I think you'll get it. If you understand the values when you go through that intake form, you will get a very strong sense of it. Yeah. If they're saying they're depressed, well, you're probably gonna give Apana a pretty strong rating. If they also mention lethargy, if they say, if it's like the main thing you'd want to do to heal or whatever the question, they're like, just have more energy, then we know, okay, Apana's strong, but what seems weak, like you can kind of do your best with that and just do your best. It's all gonna come together. All right, what's the next one? Gunas, and here you're just, I want to see what yours actually. Give me just a second. For gunas, just try to name a dominant guna. I think this too really tends to stand out. Every now and then you're like, ooh, it seems to go back and forth pretty evenly between Tamas and Rajas. If that's the case, I would focus on Tamas. It's always the worst one. I mean, I know in yoga we don't like labels, but it's a label. It's the one. it will drive that. A lot of times that tamas is so deep that then there's like a lot of caffeine intake and stress from not doing things that comes out of it that can look Rajasic, but it's that heart of tamas. So if you're not sure, personally, I'd start there. And remember, in the real world, this would probably take several sessions to kind of figure out what's actually working, what's not. Okay, then what's the last bit? Yeah, where they're at, where get them from point A to point B. This is important because, well, why? What if you have someone who's really tamasic and you want them to have more energy? Are you gonna? Mhm. Yeah, it's a lot easier to meet them where they're at and be like, okay, I want you to literally have your yoga mat next to your bed and roll out of bed and do child's pose. And then and I mean, literally like, and then do some cat cows. Like, so we're building up movement, we're building up breath. We're not just like, all right, like an 80s aerobics instructor, let's hit the mat and do 120 sun salutations.
With Jane Fonda.
Yeah, exactly. And at the other end too, if you have someone who's just geared up, Rajas, I want to point out, sometimes we correlate it just with Dhyana, but it's not just that frenetic, like here, there, everywhere, all over. That can be Rajasic, but it can also be just, I have a drive. I'm gonna get out there in the world and do this thing, and that's all that matters. But the thing is like kind of like making them sick because they work obsessively or something, right? So just to be clear, a person can be very focused and Rajasic. The Gita talks to us about what's moving us in the world. What is the motivation? So you kind of, the Gita can help you with this too. So again, a real Rajasic person, I mean, if I have someone who's like selling $80 million a year in commercial real estate and has never sat down in their life to take a deep breath, that's not where I'm going to start, right? I'm going to start with movement, with feeling things physically, because they're like, I gotta feel it to know it's real, and then try to shift that. And then you just come up with a little sadhana. Now, let me make sure I'm staying on track, because there's things I get to later that if I do them now, it'll screw me up later. So you've got your toolbox gunas, you're gonna come up with a very short sadhana plan. So this will happen also before you talk to your mentor. If you're a person, does the intake form, help me remember, does it say how much time do you have to dedicate to this?
Yeah.
Cut that into about a third. Cut it into a third. There's a thing, and they've done this with like research and exercise, where people really, all of a sudden, they think their self next week is gonna have more time than their self this week. And they're like, I'm gonna exercise every day for an hour, but there's no plan for how are you gonna make that time. It's just, part of us is very optimistic, and that's great, but we want them to have success, and I'd rather start small, and they'll kind of fight you on it. What you can do is give them a longer one for days when they have more time. And that most of them will never do it. I'm just telling you the truth. Some will, but by and large, people have a lot less time than they think they do.
It reminds me of adjustable mortgage rates in the early 2000s.
Yeah.
And that optimism.
Oh my goodness. And the bubble. It is like, I've never heard this compared to an adjustable mortgage, but it is like that. Yeah. Oh, kitty cat. Okay. So you're going to come up about a third of what they say. And this is going to be hard for you because you're going to have so many things you want to do. So let's talk about how you narrow this down. one thing is go through and circle or star, underline, whatever, everything that you have in there more than once. So you might have been like, oh, I think Warrior 2 would be good for this up in the koshas, and then it shows up again in the vayus. Or there might be a breath practice that you have in there. Like when I do this one, I tend to have Kirtan Kriya like 10,000 times. Not really, but it's one that tends to show up a lot for me. But you'll have your kind of thing, or mudra, like circle those things. That to you is a sign like, okay, start here. When I say a third of, so this is something we'll see with mine that I give you as an example. What you're gonna see, what I gave to them, I thought was about a 30-minute practice, and it's actually probably 45 minutes, maybe an hour. And so you have to do it. You have to do the practice to time it. You will in your mind be like, yeah, that's about 20 minutes, and it's like easily 40 minutes. So you're gonna do all of this to the best of your ability before you talk to your mentor. And it's really good for you to just kind of jump off that ledge and do this. And then you're gonna talk to your mentor, and you want to be prepared with this. And you want to also start thinking about if there are things you're just not sure about that you need more information from the client about, start writing your list of questions. If they mention something, but it's kind of vague and you don't really quite get what it is, or let's say you're like, gosh, Anandamaya is blank. I got nothing here. Right? Then you're gonna start coming up with a list of things to talk about with the client when you meet them. That is really helpful to have when you talk to your mentor too, because you have like half an hour, I think. Is that how long the calls are? Can't remember off the top of my head, but it's, I think that's how long it is. And so you really want to use that time well. Realize that one of the big things your mentor will help you do is kill your darlings. So even though right now I'm saying give them a short practice, you will probably get enthusiastic, a lot of you, and this is normal, this is great, this is enthusiasm, but you'll have too much. And they're gonna be like, that's too much. Cut it down, cut it down. They also, from their own experience, or just seeing things on the intake, they might have ideas. So then once you've talked to them, you'll kind of reformulate. Reformulate, test your time again, because once you reformulate it, it may be off. When you meet with your client, you'll have, let them talk a little about why they want to do this. Some other stuff, just talk generally. Some other stuff might come up. Let them know. You can say, I'm taking notes. It's just to help me think of ideas for things that can support you. Because sometimes you writing notes can make them nervous or feel like, that feeling? That feeling. You've all done teach out when we sit down and we're like, and you're like, what did she? So just if you let them know, that can help. And then ask them those questions you have. And now this is where it splits into 3, maybe more possibilities. First possibility, and this does happen sometimes. I don't know what I did. Balloons just went, some of these, oh, it's the peace sign. Although it's not consistent. Yeah. It's like you only get so many balloons. You're
You
done.
can only celebrate so much.
Yeah, you are cut off.
Maybe then everyone would be like.
Yeah, it'd be too
balloons all day.
much. Balloons all day, but what's wrong with that?
Nothing.
So you're going to ask your questions, and okay, at this point, and this does happen, this I suspect might happen for quite a few of you, is if you have someone who really knows themselves and fills out a self-aware, honest intake form, you're gonna be really close. You might have the exact thing to give them already. So if that's the case, then you teach it to them. You show them how to do it. It's important. It's like that thing like you were talking about, Amy, with belly breathing. What do people do when you tell them to breathe into their belly? This. So that we just want to really show it to them. I would also, as you're planning, think about how am I going to resource them so that they can remember what I taught them? So how could you do that?
Support yourself.
Record yourself teaching them.
Just a video session.
Yeah. Video, you can even just do even just a video guiding it. You can video the whole session with them so they can refer back to it. You can, handouts are great. I mean, I've seen people do all kinds of things, so do something. Even if it's just having them take notes, but kind of looking at their notes and making sure that they're really understanding, because when they're learning 5 new things or whatever, it's easy to forget the nuances. Or all 5, I mean, to even remember all 5 things can be tough. So that's one path. The next path is, I was pretty close, but there's some things I want to tweak. Now that I got in here and talked to you. Now that can go 2 ways. You can either say, I need a couple days to sit down, or a day, or whatever you need to come up with this. And can I get back with you? And then you're gonna have to have a little follow-up meeting with them, because you still have to teach it to them. If that's not, if you're like, I'm feeling pretty good and it's just this one thing I want to add or take away, it's just say, I need like 5 or 10 minutes just to make sure I really got this dialed in for you. And just let them go. I mean, people have their phones. Let them go look at their phone. People can be entertained. Now, the third one, and this does happen sometimes, is people who have a different version of themselves on paper than what they actually are. That'll happen for probably 2 of you at least. And that's where you're like, oh, I need to give me a few days to reformulate. Unless you're just feeling really confident with it. You're like, hey, can I have 15 minutes? Because honestly too, sometimes moving through it quickly in this process, like, so have that blank matrix with you so you could fill it out if you need to. Sometimes moving through it quickly, you get a little more intuitive, you get a little less, your critical mind can make it too hard. So I need to stop talking with my hands. Just sit on my hands. There's probably some way I can turn those off so they're not a distraction. What's that?
There are some settings you can turn off.
I like this one so much. It's not working. Okay, now at that meeting, do not let them leave without booking your follow-up. Because it's really important to you. It's not so important to them. So get it booked. Follow up, if you just need to do a follow-up to see how it went, I mean, that can be a quick phone call, that could be a Zoom meeting. It doesn't have to be a long thing. You're just gonna follow up and be like, hey, what did you do? Find out what they did, find out how it felt, what worked, what didn't. I mean, usually you don't even have to really guide it. They're just gonna tell you.
So is it like 2 weeks?
Yeah.
1 week?
Yeah, so that's at the 2-week point. So you really, and here's what I want to say about your timing too. Why it's so important to do this as soon as possible is if you get that person in 2 weeks and they disappear on you, usually because they feel guilty because they've done nothing. Or they just they do show up, but they're like, I did nothing. I would really suggest trying to find someone else and fitting them in. Because you want the experience. So that's, if you give yourself that time, it will allow for that.
Question, check-ins. Is it
Uh-huh.
wrong if they need it more regular? Like if your client straight told you like, I need an accountability buddy, like is it? okay
Yeah,
if we
that's
check
up to
in
you.
once?
And your boundaries and your,
Right,
what
yeah.
feels okay for you. If they need like an accountability buddy or something like that. I personally, when I work with people, if they need that, I am fine with it, but I set up how it's gonna happen. Which I just want to give as a general tip to people is, if you're not comfortable with if you were like, this person's probably, if we do phone calls, they're probably gonna call me and take up an hour and I don't have an hour, then just be like, okay, I will text you on and I'll ask you some questions. Yeah, good question. Okay, so we have talked about taking all of this stuff, putting it through this grid, which by the way is, I want to talk about why this is so important briefly. When I went to school, when I got my master's in teaching, we had to do something kind of like this for lesson planning. Every lesson we did for a year, and when you're interning teaching full-time, that is a lot of, I mean, it was painful. But I will tell you this, it is like installing, I don't know, is it software or hardware? I'm not a software into your brain so that it becomes easier and nothing slips through the cracks. So if you do this, the more you do this, the more it just starts to be there for you. So when you work with people, you don't always have to sit down and do all this. But if you're really good about and consistent about doing it at first when you work with people, it's just gonna help you be sure that you're really considering their whole person. All right. I will talk about your little presentation that's due next, but before I do that, so we talked about filling this out, about how to prepare for your mentor, and then what to do at the meeting, how to prepare for that, setting up the follow-up. What else can I answer for you right now? I'm gonna give you a second to think about it. That was great. Go ahead.
So I'm actually working with, first one is my sister, I sort of know her pretty well.
All right.
But on her intake, it was hard to decipher some of the values, and I'm sort of going off of what I know about how she's outgoing. And I'm sort of using, because she's got more physical stuff going on,
Mhm.
so I'm sort of using some of those physical areas maybe to direct the value that I can maybe direct that to. Is that okay?
It's okay, yeah,
Yeah.
and part of this too, especially early on, is gonna be a little bit of experimentation. Yeah, but that sounds like a really good plan, Amy, and it is, I will say this about working with with people you know, sometimes too, and you're not saying this with your sister, but sometimes you know a person and then you read that intake form and your eyebrow, you're like, really? So it gets tricky because maybe there's things they're sharing on the intake form that are deeply true that they don't express and show. You kind of have to navigate that on your own if that's the case.
So for everything, we have 2 clients, but we're just doing 1 this month?
Yeah, you're just doing the mental emotional.
Okay.
Oh, I was
Uh,
doing physical, because I have,
No,
okay.
that's what everything is said on the, yeah, sorry. Don't do physical because you won't, I mean, you will because you have such a background in it, but you don't get the physical lesson like today until next month. Yeah, so will you be able to, but you know what, Amy? No one doesn't have Monomaya crap going on. So if this is what you have right now, just do it. It just know this, it would be nice to save someone with more physical stuff to focus on for next time if you
What
can.
if you really want your stuff now? And the other one's like just been slowly coming.
I just think your learning is what matters
Yeah,
here.
okay.
So you have to decide what, yeah, I know. If the other one's dragging their feet, I'd ditch them. You cannot drag people to this, and if they are dragging their feet, they are gonna make. Again, what are you willing to do to heal? Well, first thing is be in contact with me and don't drag your feet.
I think I already need to change both. Well, from the results of what I got back and what they filled out, it was like 2 words per thing, and just knowing that, I'm like, are they really gonna show up? Like, I don't think so.
I would, if you have that sense, start looking again because it really will. It happens. And it's a lot of times if it's people who are doing it just to help you or because they love you, it's hard to get them to actually do the things too.
I guess too, I have a client at work, like a cancer patient, who could do treatment, and she found out from someone else that I'm a yoga teacher, and asked all the questions. Which you said, if you ever need anybody to do anything, let me know. That brings up a lot of my own fears, like, what if you guys before this is over, and then you're like mixing all the things with work, and they're just gonna see me at work, like, I've been seeing. it.
And that's up to you. What is your,
And she could,
she might, yeah.
But you're providing the yoga before her death, that's amazing.
that'd be cool.
Yeah.
Especially that Anandamaya kosha, if someone is potentially dying, I just think that Anandamaya kosha stuff can be really powerful.
I just got tingles, so I will reach out to her.
Okay, yeah, it's your determination.
Thank you guys for letting me talk about that.
Yeah.
Question before you- Do we, if we're working with them and some of our feedback we're getting from them is like, I need to switch stuff up, that's okay too, until I maybe.
Yeah. So great question. If they are if you're working with them and they're like, I need to switch things up or this or that. So
Just like not doing it or like doing certain components and you're like, oh shit, I thought it was over here, but maybe I actually need it.
that's it is like tuning a guitar, honestly. What will generally happen is just you're tuning or any instrument really, but you have to go flat and then sharp and flat and sharp till you find that perfect spot in the middle. So realize that I'll be surprised if any of you their sadhana you give them, if they're just like, I did everything and it all worked. Chances are they're like, I didn't like that, so I never did it, and you might be thinking, but it be so good for you, but, and also don't take that personally. Or I love that, and so I focused on that. It's just like when we have our mid-month check-in and talk about sadhana, and you're like, I haven't been doing da-da-da, but I've been doing da-da-da. You're gonna get that. And what you would do if you continue to work with them, and what you can say after your check-in is if they want to keep working with you, at that point, it's up to you. You're a yoga teacher and your time's valuable. You can either do it as something, if you want to keep working with them, you could start to ask for a fee, or you could just be like, I want to get more experience and this is really valuable. Or I just don't want to do it and thanks for the feedback.
Is there any wisdom into building different levels of achievement into the practices that you recommend?
Yeah.
You know what I mean?
Mhm.
Giving some that are very easily attainable and some that are a little more difficult.
Yeah, and really one of the biggest barriers, honestly, is the building levels of achievement. And it's usually time. Is just if they can check it off a list and they've done it, that's huge if they can be consistent. So keeping it short, but then giving those longer ones for other days where, okay, I got in the 20-minute one. The thing is not to present one as having higher value than another, because what happens, and this happens a lot, well, I think I may have told you about a student we had years ago who did her sadhana every morning for like I feel like it was the first 5 or 6 months of the program. And she did a 90-minute sadhana every morning. Well, if that is always the only way to do it, like some people are just so perfectionistic that even if you're like, you can do this 10-minute one or this 20 or the 30-minute, they're like, well, I'm not going to do it unless I do the 30-minute. So you have to assess that too. But also just, you can build in things for growth. Like once you get this, then change it to this. But to a degree. And also you still want to keep structure to it. So, yeah.
I was thinking more like gratification. Like if they do something and they notice that it's helping almost immediately, they might have incentive to do more. Does that
Well,
make sense?
okay. So let me rephrase this too. When I go back to the time thing, those are the things that are going to go in that 10-minute sadhana,
Mhm.
is the things that are definitely going to work and incentivize them to do more.
Okay.
Yeah. And some of those things that are surprisingly powerful are, one of them is sankalpa, and you don't have to use that word if they are uncomfortable with Sanskrit, but that's a good one. A lot of the breath practices, belly breathing. What else?
I have a question.
Yeah.
It's more maybe an observation, but so before taking this training, and I knew we were gonna work with private clients, and my mind was thinking, working with a private client meant going maybe to their house or whatever and giving them a going through asana with them, does anybody else think
Yeah.
that? Do you ever do that, or is that part of it,
But I
or?
gotta sneak in some other stuff too. Like
Yeah,
I
yeah.
never, if someone's paying private client rates, I'm not gonna just go teach them a vinyasa class for an hour without personalizing. See, I can still be like, okay, there's a lot of Vijana, so I'm gonna sneak in some Samana stuff. I'm still going to take all of this into account for them. This is just a little, so there are really two roads with that. There's the people who are like, I don't want to do a public class for whatever reason. I just want you to come teach me yoga for an hour, and you still can use this to personalize it.
Mhm.
You
Okay.
just don't necessarily give it to them as like, now go do this all week. It's gonna be starting with an intention that's suitable for them, all of this stuff.
Okay,
Great
makes
comment.
sense.
But a lot of this, we get a lot of people writing in with, I have this or that or whatever, and, I'd say it's almost 50-50, really.
Okay,
Yeah. Okay,
thanks.
yes.
You said Apana, when they were very like depressed, that was high in Apana?
Yeah, because it's heavy.
Okay, I guess I need to keep looking at that one, because I felt like, it's grounding Apana, letting go.
But if there's too much of it, what does it turn into?
What was the trauma?
It's tamasic, it's heavy, it's an inability to move, to lift oneself up.
Okay, so depressed is just down, they're down, then you get.
Heavy. Yeah, so what, and so more importantly than, so the question is Apana and depression. More importantly than Apana being too strong, you're gonna look at what's too weak. Is there any joy? Is there any of that prana, that heartfelt moving are they able to move forward? That's what prana does. If not, if they're just stuck, I don't even care that Apana is heavy. I care that prana is not letting them move forward. It's weak. Or I care that there's no connection with something greater than themselves through udana.
So they don't talk about a religious belief or God or higher, then you probably think that.
It doesn't have to even be a religious belief, but if they have no sense of, I just want to say connection with something greater. And it doesn't have to be spiritual or religious. It could be purpose. Meaning, meaning in life, and this idea of just inspiration.
And those sort of together, Prana, Udana, both coming up, Horizon Divide.
A lot of times, yeah, if Udana is weak, a lot of times prana will be too.
Okay.
Yeah. And that's why prana is the one that gets thrown in the mix, because it'd be easy to be like, apana is too strong, so I'm just gonna do udana, because it's the opposite. But prana might be weak too, and we're neglecting it. So to me, it's like, let's look at all of those. Does that support you, Amy? Okay. Okay, so I'd like to take a break at 11:15. Is that good? Can you do 19 more minutes? Or should we do a break now? Well, you can always take your own break.
19 minutes, let's push through. Anyone else?
The energy is just, blah. Let's do this. Well, you can potty anytime though. I've been very clear about this. Take care of your body. You can catch up on things later. I don't want to, but let's take 15 minutes starting now. It's 10:57. Do the math. We'll see you in 15. Move, please move, because there's a lot of Apana in this room right now. And it's okay. I know you're tired, but please move. Okay, we'll see you in a little bit. A couple more minutes.
Makes sense. I mean.
All right, let's start to come back around.
That stress.
Would you like to do pulling prana or breath of joy?
What was
Pulling prana?
Pulling prana.
I'm getting more I'm getting all kinds of, okay, we're gonna, all right, let's pull some prana.
helped with her energy. She really helped. She, we were like this fun and she just like shit off. on us.
Did she? Andrea did?
I was giving it away.
All right, she's giving away energy.
What's up?
Okay, let's do a little pulling prana then. So bring your hands, palms forward, arms overhead. We'll do the pumping it with the belly. Find your own pace, but be pretty vigorous with it. And imagine you're pulling the prana down into the crown of your head. So big, let your belly be loose first. And then on your first exhale, slap it back toward the spine and begin. You're making fists as you come down. Forceful exhalation, the inhale happens on its own. Kind of sense what feels right for you right now. I'm not going to tell you when to stop. You decide. I mean, unless you go for 20 minutes, then I'm going to tell you to stop. When you are done, take a moment to let that integrate. Just being mindful of the changes it creates in your physical Annamaya kosha, your pranamaya kosha, in your mind, manomaya. All right, let's do the second step. So fist at the belly. You can do thumbs up. I like thumbs wrapped in because it's really working on samana for that one pointed focus. Inhale, hold it, and breathe when you're ready to breathe. Don't pass out. Inhale. Close your eyes. I think it's nice to pull up a little through Mula Bandha and just kind of just getting a little bandha action going. If you want to add all three, you probably could. When you're ready, you'll let it go. Just notice how that again shifts the energy. And last one, palms up, forward. We hold the breath. It's going to be tempted to do that pumping action of the breath. Inhale and make fist pull it in. And you know what to do. You just stop when it's time for you to stop, and you'll rest with your eyes closed for a moment. Come back. So we talked about a lot. We talked about vayus, koshas, gunas, how to bring it all in, look at the intake form and what you'll be doing. Our next step is to look at this example of yoga for anxiety. And that's just the next, do you all have it? I think it's 4.3. Yeah. So I want to go through this just to share with you my thinking and how I did this and some things, lessons I learned. This is, by the way, this went great, but there are just things over the years you learn and you change, and I try to share those things with you so you can get, let me learn that lesson for you. But for the most part, so just to give you a little background, this was a woman in her 30s, kids, husband, job, very busy, very stressed, just, high anxiety, and just wanted to do some yoga to see if that could help. So Anamaya is, how does that look physically? So this was one she had noted in her intake form, her chest felt tight in that place where do you feel it in your body? That's where it showed up physically for her. And as soon as I met her, I just noticed she kind of, when she talks, it'd be this kind of thing. And she also then, she had some neck stuff, but that was, I think, all tied into the chest tightness and the shoulder shrugged. So I just wrote down some ideas, and I want to point out you can, you'll have more for this section after you work with Erica and Laura, but you also can pull from your toolbox to an extent. Like if you know about like myofascial release stuff that's good, like rolling on a ball, like laying on a ball in certain ways, or using a foam roller, things like that, you can certainly write them down. I have some stuff that I like to use that's really tends to help with this kind of stuff. I put eagle arms, and you notice this has an asterisk next to it. Anything like that, if it's something we haven't specifically talked about, I give directions for it immediately following this grid, and it's in the order in which they show up in the grid. So eagle arm, it's just to help you. And by the way, then you can add those things to your toolbox too. Eagle arms is a really fantastic one for a lot of times the shrugging of the shoulders. It just makes that upper chop just won't let go. And it's just literally eagle arms, and you can just do different. You can bring the arms one way and the head over the opposite way. And that really gets into there. And then doing the same on the other side. You can also do, I mean, there's just all kinds of variations that I found particularly helpful. And it's something people can do. By the way, you can give them little things like if you're sitting at your desk, you can do this. Whoop, okay. Gentle chest openers. I wrote bridge or supported fish. She's so tight through her chest that I knew I just didn't want to force it open. And there's just certain things like I talked about with grief too, if this isn't a grief case, but there's just times we don't want to force this. We can start to suggest it. And with her, just the stiffness and tightness she had there, I knew it needed to start real gentle. And I put supported fish because of course I know with the anxiety, anxiety too can feel, even though a lot of times we want some of that prana to start to come into it, that sense of love and expansiveness at the same time, heart openers can feel too much, right? So this is kind of what I wrote, because I was like, well, she has tightness in her chest, so let's see if we can start to work on that a little. Is this making sense so far? Okay. Pranamaya, how is vitality, energy, overall health and well-being? How's it doing? I mean, she was wired and frazzled energy, but exhausted underneath it. So you know what I mean? And you've probably felt this way. You might feel that way right now. I don't know. Where you're just like, what? But there's this deep fatigue underneath. I wrote down, and so some of that you can get from the intake. Sometimes they just write it, and sometimes it's just from talking with them. Grounding movement and poses. Why would I say grounding movement?
And soothe the anxiety.
Yeah, just, I mean, wired and frazzled to me is like, we want to get some grounding probably going on here. But of course, I'm going to look at other stuff later. And if it comes up again, I'll do it. Ujjayi breath. Does that surprise anyone? It's very calming. And it also is energizing. It is a great breath to calm and energize. And we overlook it because we use it so much that we never think to just have someone sit down and do Ujjayi breath. Let's do an Ujjayi breath. Okay. Inhale. And exhale. Do another one. Inhale. And exhale. Doesn't it just feel good? Okay. I hope it does. Alternate nostril. I mean, there's almost going to be nothing that's not good with alternate nostril breathing. It's so balancing. And with this one, I'm like, she's got all this, but also this, and so to me, I'm like, oh, that kind of makes sense. Have we done Brahmari breath, bee's breath?
No, and I want to learn it. Can we do it?
Yeah, we will do it. Let me get through this one and then I'll show it to you. And there's also an alternate option for it. Longana breathing. I think you've actually learned this one because we talked about it. It's what is that? Yeah, extending the exhalations. And of course, belly breathing. We've talked about it in here. I have a star next to it. Sometimes we get to it beforehand. Sometimes we don't. I want to point out belly breathing is so great. Actually, because of the way the psoas comes into the diaphragm, it helps to relax the diaphragm, which can help relax the psoas, which can release so much tension and also help with lower back pain and all kinds of things. But the psoas muscle, this is something I learned in my one of my trainings with a gal who does structural yoga therapy, but apparently the cells that make it up are more akin to organ cells than muscle cells. It's really interesting. So the psoas is kind of like sensitive in a different way than our other muscles. So one way to get to it is through the belly breathing. Of course, especially with any of the breathing, but belly breathing, watch them do it. Does this list make sense so far? Okay. I'll get to, let's do bee's breath at the end. Will you help me remember?
I will, of course. help you.
Okay, thank you. Manomaya, is fear involved? Negative, hurtful thoughts, emotions, or their unhealthy actions, patterns, habits? I mean, just a real deep fear and stress. Generally, the thing they're stressed about is a fear. So if they're stressed about getting everything done, not being enough for the kids, the husband, coworkers, that's a fear. Right? So I have here, I thought maybe Hum Premal, which is just a little mantra you can use. It's I am love. I am divine love. Om Shanti 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 just feels good to do. It could be that simple. I thought developing a sankalpa or affirmation. I wrote down some ideas, although when you're doing sankalpa and affirmation, of course, support them, but really let them come up with their own thing. I usually jot down ideas in case they're just like, I don't know, and like just nothing. like just to kind of get them going a little bit. Okay, lean into resistance. Like I will also sometimes just add other concepts or things I've learned about or am learning that feel appropriate and not completely outside the realm of what we do. At the time I did this, there was something I learned from an Ayurveda teacher about love letters, and I don't even remember what they are now, but I used to use them a lot and I'd have to go back and look for directions. But there's just things, if you have tools that you feel like are appropriate and okay, you can add those. Bhu Mudra, do you know this one? On the ground, right? Everyone knows it now. Back when we started this, no one knew what that was. But do you get it in classes a lot?
I got it yesterday.
Oh, you did?
I mean, went to Florida before we.
That's great. I love that. Okay, so do you have anything you want to ask me about with this one? You good? Fairly intuitive. Is the process, as you're seeing what I do, is this kind of like feeling doable? Does it feel, okay. That's my hope for you today. I mean, that's my main thing. I just want you to walk away and be like, oh, I got this. Instead of like, oh dear God, what are they making me do? Vijnanamaya kosha. Are there unhealthy actions, patterns, habits, which of course might be Manamaya, it might be here, but I'm gonna address it one way or another, dang it. Is there a lack of self-control, like lying to oneself, or a lack of discernment, all of these things? Never saying no is a breach of integrity to oneself. If you know you're too tired, or if you know you can't do something, or whatever the thing is, that would go here, I would say. I probably wouldn't put this here now. I don't know. It doesn't really matter, but I did note she has a habit. She drinks coffee all day long. So this also could go in pranamaya. This could go in manamaya. I mean, this is just coffee all day, every day is going to really intensify everything she's going through. So I put down like you can come up with simple little meditations too, right? Like visualizing light filling the body on the inhale, anxiety, and maybe even, if it has a color or a place in your body, visualize it leaving as you exhale. So even though, yes, we have certain ways we do yoga meditation, it's also okay to do like visualization type meditations for people. Now I would probably add yoga nidra to this somewhere too, by the way. Excuse me. So Kirtan Kriya, you did that last month, and it's rare. It doesn't show up in a list for me, and it's rare. I have a gal. Did I tell you about the gal across the street from me who's been doing it? My neighborhood. I'm just their little yoga teacher because they won't come to the studio. I'm like, literally, I live. If you went down to Hancock, turned left, and then right, and then left, I'm right there. I mean, it is so close. And I cannot get people to come to the studio. I'm like, I'll give you some free classes. Anyhow, I'm sure you feel that way with family members or whatever, where you're like, please just do some yoga. But there's a gal who lives across the street who is having some real memory issues, and I gave her Kirtan Kriya, and it's really helping her a lot. She's excited. So, and she's not doing the full 12 minutes. She's doing, just an abbreviated version and already. Mhm. Yeah, I mean, that's the research. I have it in here, by the way, if you go to that, where it explains it, it does have, links or the website for if you want to read about, this Alzheimer's prevention.org research. They've done some really cool stuff. Shanti introduced us to that, and her friend runs all the Kundalini people who've been in it long enough know each other. Anyhow, he's been researching it for decades. And of course, I would also say this about my list. Just looking at this, I'm like, I can think of probably 8 other things I would add. So I would say add more, like fill it up and just be prepared to cut.
So can I say something?
Yeah.
Amber, like when I look at your list, it makes lots of sense, and I totally agree, it looks wonderful. But I don't know that I think of putting anything of those on there.
You don't have to. You come up with something different. Your assignment is not to be Amber.
I don't know.
You're gonna get Kathy. So you're getting ahead of yourself. You're gonna get practice with it this afternoon,
Okay.
or not this well, kind of this afternoon, soon. Very soon, in about 15 minutes, soon.
What if a client asks like, for the, maybe not on my end, like, I actually need a stimulant in the middle of the day, like I drink coffee all day.
Mhm.
If I don't have my coffee at like 4 to 6 to get me through the evening with my kids and family, well, how can we help them? Would it be like building tapas, like do jumping jacks or something instead?
Yeah, so like if they say, oh, I have to have my coffee between 4 and 6, or I can't, when my kids and husband get home, I don't have the energy to do the things I need to do. And you may, and that's, you may see that, and then you just have to decide. I would, depending on how tightly they're holding on to that, I would, and if I know I'm gonna work with them quite a bit, I would start to poke at it slowly. So start with just mindfulness. What's the sensation that drives you to reach for it? And then I would be like, okay, what if before you reach for it, you have a speed bump? So, you're about to reach for it, but you're not allowed to have it until you do 25 jumping jacks. And then if you still want it, you get it. And then you just kind of keep increasing the pause between the stimulus of the body feeling tired and oh my gosh, and the wanting to respond. Yeah.
What about different type of substitution though? Like, instead of coffee, maybe like black tea.
Yeah.
Which has less caffeine.
Yeah.
and-
I mean, anyway, you're just kind of titrating, right? You're just cutting it down into less and less. And there's many ways to do it, like delaying the time till they do it. Delaying the amount of caffeine. And saying okay, start with a cup of tea, and if that's not enough, you can have 2. But start with 1, and then you have to wait half an hour, or, things like that. Some people aren't even gonna want to deal with that, and they're not open to it, and that's fine. It's not time for them for whatever reason. Anything
I have
else?
a quick question. I
Yeah.
have a question. How much, like, do we peel back the curtain? Like, how much, like, do we tell them, like, the whys and, like, explain our reasoning behind things? Do we want to, like, open with it and say, like, hey, your energies are feeling all over the place, so let's focus on some inward? Or
would.
how would you go about that?
I don't, unless they're like a yoga student and really interested in that stuff. I give very broad, simple things like, okay, what this is gonna do is help because it can be hard to say things without sounding judgy too. Like your energy's all over the place, people hear, who knows what they hear, and therefore you suck, right? Like with their subconscious scripts. So just being like, okay, you said you feel this way, so this is what we would give in yoga that might help with that. So kind of generally flipping it kind of onto them and their observations. You also don't have to explain every single thing. Or you can in just very broad terms, like this should help with the anxiety
That you told me about.
that you told me about. I did not diagnose this.
Oh my God, can you just take a deep breath? You're making me so anxious.
Yeah, right. Yes.
Right.
For my client, I like know what's going on in their life. He's like a friend of my boyfriend's friend or whatever. And I know like he's going through a really messy like divorce right now and work and everything. So I was like, oh, he's perfect. I'm gonna work with him on that. But he really didn't say any of that in his intake form. He just said it's like very high stress life right now. And then he said he wants to work on like flexibility and strength. And I'm like,
That's such a.
I know, and that's also like the thing, I'm like almost feel intimidated now because I don't know, like with me being a female, I feel more comfortable with like working with a female.
Mhm.
And so now that he's male and he's saying all of this, I feel like he's very strong in what he wants. And I'm like, but I know
Ah.
what's going on in your life and I kind of want to, I don't know. I just
So
don't
this
feel
is where you think of where you're gonna meet him out and take him. So you're gonna meet him with some very good physical challenges,
like-
and then has just hands right here. You're going to, I would still give him those things because also they're not gonna hurt him. I
Yeah.
mean, a strong physical practice for a lot of people, that is the key to getting the mind to start to slow down a little. So it's gonna be great for him. So I would, but I think you also have a deeper question, which is what about when you see your client needs something different than what they're asking for? And that happens, yeah, Melissa.
I just wanted to add something in that. So what I observed a lot, I do work with animals in veterinary medicine, and I see a lot of walls that people put up between clients and technicians and veterinarians, and they come up with an illusion of wanting to control what they can't control, and I see a lot of what you're describing, and there's obviously a deep-seated grief for the loss of the relationship. And for me, when I think of that, I think of, well, this is the level of vulnerability they can give us right now. Can we meet them where they're at? And then maybe just that will soften it even 1% to where they'll be open to be like, oh, maybe I'll do a mantra or do something else. So I feel like that's more common than not, where that vulnerability is just such a challenge because we just want to control.
It can be. And were you all able to hear what Melissa said? Cause that was really just spot on. Yeah, I mean, it is very common. And it'll be interesting because you're like, but you're the one who came to want to see me, and yet you've got this list of things you will do or won't do. And like, and so you have to determine too, the person, and generally 9 or more times out of 10, I would say, yeah, just that is the whole idea. Meet them where they're at and shift it, even if it's by like not even a degree, like just give them what they want and then give them little subtle things that accomplish this other stuff. So we start to just crack it open a little.
I think
Yeah,
I'm just
thank
having
you.
Expectations of what's gonna happen, and they need to let that go and just like
Yeah.
go into it with open mind.
Well, and it is worth saying at the beginning, when you first sit down to meet with them, here's what this is. At the end of this, I'm going to be, something you definitely can say is, I'm going to give you what's a small practice. And in yoga, we know even the small things add up to a lot. So you might not feel like it's a lot, but it's more important to be consistent. And then we can always add more if you want to. And in yoga, we recognize there's many layers to who you are. So this practice is going to be designed just for you for all of these aspects of yourself. And it's going to be different than going to an hour-long class where you sweat a lot or something. Yeah.
And if you're uncomfortable about him being a male, just do it in an open forum place, in your home with your husband or boyfriend nearby.
What?
I think it's just not even like it's just like a slight feeling of that. It's like not even like I'm scared of him. It's like he's very open, he's very nice. It's just like a,
There's a lot
there's a
going
low.
on in the energy field.
yeah.
There's a lot, a lot of.
And he almost just like
shared-
hides it. And he's like, I'm great. Like,
Yeah.
I'm great. And I'm like, but I know you're going through a lot right now.
Yeah, I mean, what I took it to mean, and tell me if I'm wrong, is you meant more like him being a male who's like, and you're not gonna tell me what to do. Or like, I know what I need and I'm like that
Yeah,
kind of
like, he's
stereotype,
not-
not so much feeling unsafe.
He's confident. He's confident in what he knows. And I think it's just like, maybe I don't have as much confidence. So I'm new to this. And like, he was just very open for me to like help him. And he's like, Kara, like, when are you gonna help me? When are you
Yeah.
gonna help me? Like, they can do yoga with me. And now that I'm doing it, I know he's gonna be really like tuned in and like ready for me to give it to him. So I'm like, okay, I need to be ready then to like, do this for you. But I also know you're dealing with a lot. So like,
Yeah.
He may be the kind of person who waits until the last minute. You've got 3 minutes left in your session and he's like, oh, by the way, I'm going through a divorce.
Yeah.
And then he'll unload
Yes.
I always want people just to like let it go. That's why like I kind of just want to like follow the strings and just like just cry for me a little. Like it's
Just cry for me a little. Yeah, and it's also a tricky thing when you know people have stuff going on, like we said, and they don't put it on their intake form. And that's where you have an advantage and a disadvantage both. So
You almost want to parent them, just do what I say, I know what's right. to
just,
do."
yeah, just do what I say. Like, trust me, I'm seeing things clearly and you're a
Fine,
mess.
it's fine, I know what you mean.
Oh,
it also comes to like respecting people. Are they not ready to go there?
Yeah.
Oh,
So it's
yeah.
Like just let it go. And it has nothing to do with you. Yeah.
yeah, and that's the thing, if he doesn't like anything you give him, it's not about you. And that's very hard. And any of you might have this experience where the person's like, I hated it. And you're like,
I want to say something. My wife hates everything that I do for her as far as yoga is concerned, like, cause she's just, that's just how it is. But she knows it's good for her and things like that. And so like, she is upfront, like, why, how do I have to, like, where, like, so she's really confronting with it. And so like, it's just one of those things that you just kind of, but it's good because
Yeah.
then we get to learn, because then they're sitting there going, this is how it feels for me. You said it's supposed to do this, and this is what I'm having. So then you're like, oh, let me think about that differently.
yeah,
You know, so I think it's really important to meet them where they're at. So you're sitting there going, I'm just here to support you. This is what I thought. Let's give it a go. If it doesn't work, cool.
Yes,
Let's move on. 'Cause,
absolutely.
like, they know what they need kind of better than we ever will, right? Like, at least for that moment.
Yeah.
And seeing it from a place of responsiveness versus reactivity, realizing like what you said, it's not even about us, it's just about them navigating their journey at this moment in time.
Absolutely. They're navigating their journey. We have no way of knowing. All we can do is say, here's some yoga, and then let go of the fruits of your actions. Let that be your mantra this month. Let go of the fruits of my actions. Like, even if he comes back and he's like, I hated it. Okay.
Well, now you know what you
It's
hate.
good practice. In some ways, it's good practice to have someone like that. For sure.
But maybe you're talking about the rationale and saying, at first this will bring up even more anxiety.
Yes.
It's gonna bring up these emotions, these sensations.
Yeah, you can always give people some scaffolding so they understand some of the things that might come up, for sure. Let's do this last little bit, cause I need to get moving so we can get into your stuff, so you can get some practice. Anandamaya Kosha, really, I didn't get a lot. There was, just really blissful, relaxing with her family, but didn't get a lot of time to actually do that because everyone had activities. Everyone's lives are so scheduled, like even kids. So, ideas like, well, can you devote the practice to the health and well-being of your highest self or of the family? And then just little things like schedule actual appointments for fun time with the family, but bringing it into a devotion too. Values, here's where one place I would change things. Knowing what I know now. Do you see it? Look at the values. I put Apana 1 and Vyana 5.
Yeah.
What is it?
It's a 1 and a 5 instead of like ones.
Ones. Yeah, yeah. I mean, I just focused on that. This is until I kind of realized how much I would chase one thing and kind of be missing, it took me a while to get to the point where I'm like, oh, it just really is effective to go for the week 1 or 2 or 3 even. But, this is how I did it back then. So I just wanted to point that out, that that's something I've really learned from doing it. I do want to point out too, Vyana could be low with anxiety. Don't always correlate Vyana with high Vyana with high anxiety. If someone is really introverted and can't leave their house and has social anxiety, it could be very low. But in this case, that's not how I would be doing that anymore. I would, for her, focus on the Samana was definitely low, so I would have instead just shifted to more some strength and samana and apana kind of stuff. So I wrote strength and apana with grounding poses and mudras, childs, just wrote down some ideas. Counter Vyana was samana. See, instead of just like making sure, oh, it is samana that's slow. Cause what if it was prana? What if it was, it wasn't, it was fine, but, so I put some good samana poses and, the Adi Mudra, which we do as part of pulling prana, twists, all of that. Guna is very Rajasic, so practices to consider. 3-part double down, that's a good one. People, once they get the belly breathing, they like that stuff. It's not always where you would start with someone. From point A to point B, I was like, okay, she's Rajasic, she's got tons of energy, so I want to start with sun salutations, work into longer holds, end into floor work, breath work, meditation, deep relaxation, affirmations. Keep the practice to 20 to 30 minutes. Well, this was nowhere. I mean, just look at that list of things. How could that have been 20 to 30 minutes?
But what did you actually apply?
Well,
Because you probably didn't apply all of these things on your list.
no, and I didn't once, but I did. I now would never even write a sadhana this long. But I do want to talk you through it quickly. So building, and I kind of build to it over a month. Was my plan. So give her a little at a time. So starting with 3 rounds of sun A with some warriors and eagle, adding the eagle arms, warrior 2 triangle, blah, blah, blah. Navasana builds samana, just getting her down on the floor, thinking about the whole thing. Anyhow, I don't want to, you can look at this whole list if you want to, you don't have to, but, you can just see this is of quite a long practice. So what I actually wound up doing, because this was just way too long, this was an option for her because she was also a high, like what I wound up going with her, she was someone who wanted it all, kind of like your person might be, where they're just like, yeah, if I don't do an hour and sweat my ass off, I've done nothing. So I did teach her the whole thing, but I gave her shorter variations with 1 sun salutation, a warrior 1 and a warrior 2, and just told her where she could cut things out. But then I gave her a really short version. And I said, I don't care if you ever do the long one, but I would like you to try to do this one 4 to 5 times a week. And so it was ending and beginning with her affirmation. And we worked on that together. If you are going to do a Sankalpa or affirmation, plan on a little time in your meeting with them to support them in developing that, okay? Ending it and beginning with it infuses it with a certain bhav, a certain focus. It brings in a little of that Anandamaya, because for hers, it was about her children and her family. 1 sun A. It doesn't sound like much, but it met her at where she was moving. I gave her a warrior 2 to also meet her where she was at, because Vyana was out here, right? And it was like, I actually need some samana, but I want to meet her out here. But if I'm holding her still in a longer warrior 2, it's starting to bring it in. Yeah, Drishti is a great thing to bring in too. Nava, and then just down to the floor, Navasana. Why is Navasana going to help someone like this? Boat pose. Yeah, so now we're getting to Samana, but it's still got a little Rajas to it because it's still got some physical challenge, and she's going to feel it. And she's just someone who very much needed to feel things. And most of us do, that's okay. And then we would get down to either supported child's or Makrasana, her choice. But a nice, several minute hold. I like Makrasana, that's crocodile pose on your belly. We're not getting into Ayurveda in here, but it is pitta reducing. So the heat, that hot element, when someone's too hot and fired up, it's basically, right, like Shavasana, but on the belly, and it is a pita, it's supposedly, and I do think this is true, a pitta reducing pose, but adding in belly breathing with it. Makrasana, she's on her belly, so she could actually feel her belly push against the earth. This is someone I had a very hard time teaching belly breathing to, but when she could feel it push against something, it helped. So she kind of had a choice. The supported child's also, it is more constricted here, so she could actually get that sensation. And then ending with her affirmations again, that simple. This here is about 10 minutes. It could be 15 depending on the time she spends. So do you see the difference between what you might want to do versus what's actually you're probably going to give them? This is not, she did do it. And actually I had this is someone who came a long way, really. And what I want to say is, remember I said some people, if you give them that really long one, they're going to think, oh, why bother with the short one? Because it's the one for, it's like the D-. Why, if I'm not going to get an A+, why do it? So you do need to take that into account, but you also just might need to have that frank conversation. Like, I want you to let go of perfection. That's part of your practice. And that means in your mind, if you think this longer one is perfection, well, A, you're wrong, but B, I want you to practice being imperfect. I want you to rebel a little and do the short one, even on a day where you have time and energy for a long one. Like, so kind of, and then that in a tricky way, that becomes the new way to, I don't know, get a gold star. Okay. So that's how it all comes up. And then of course you meet with the person. If you continue working with them, you know, the things they really like, you have to consider, do they really like it because it actually is supporting their bad habit? You know, there are things we want to change. Like if they're kind of like aponic and tamasic and they're like, well, didn't do any sun salutations, but I did support a child's pose every night for an hour. It might not be the thing. I mean, you keep it so they keep motivated, but right. But then sometimes the thing they really like is the thing they really need too. So you have to kind of discern.
Can I ask a question about the discernment?
Yeah, I'll try to answer. We'll see.
When you're assessing your gunas and the values and everything, how do you assess it with chemicals on board? Like you said, she drinks coffee all day long and you think her dominant guna is rajas. What if it's not? What if that's coffee, or does it matter?
Great question. If there's like chemicals on board, or like someone with ADHD on a stimulant, or someone who's depressed who's on an antidepressant, or there's all kinds of things. What I do with the coffee, like this is just such a common example, is I am treating whatever, I am trusting that it's gonna, even though I'm gonna address this jitteriness and this hyperness, I'm also gonna trust that some of this deeper stuff that drives her to think she needs so much caffeine, that feels so like lacking in energy, that I'm gonna get to it in these other kind of like deeper ways, the meditation or the belly breathing kind of stuff. So it's tricky, Kathy, but you keep it in mind. You certainly don't treat them as if it's not there.
Yeah.
And I shouldn't be using the word treat. You don't give them things as if it's not there, but you still want to attend to what's really going on deeper. The koshas are going to get you to what's really going on deeper. Yeah. And the more you do this, the more you realize that. Like, it's one of those things I can try to explain, but when you do it, you start to get like this confidence in not even yourself, but just in the yoga, that it'll get to that.
Thanks.
Yeah. Should we try bee's breath and then do a little practice ourselves with some of this stuff? Zzz. Okay, so Brahmari breath it's the very, right after eagle arms. I want to show you there's two ways to do it. For some people, so thumbs press into and it says it here, into the cartilage, right between your ear and your cheek, right? It's like kind of right in there. And so it's going to make, when you are going, it's going to sound like a hive of bees in your head. Okay. And then you put one on, oh, how do we do this? Let me make sure I have it right. Ring finger is just at about the eyebrow. Nope, just kidding. Sorry, I have an alarm going off. I have to build from the bottom up. Pinky at the outside of the mouth. Ring finger at the nostrils. Middle finger over the eyelids, no pressure. And then just above that. And then, of course, thumb at the ears. Now, for some people, this is intensely anxiety producing. So for those people, if you look at our friend here, there's still the pressing in. They can control how much they press in and how comfortable they are with closing off their hearing, but then just bringing it to the head. But this is generally, it's a pratyahara technique. We're sealing the senses off. So let's do 3 rounds. We inhale and then you do, you hum. It's not a pretty one. Let's do it together so we can hear how ugly it is. We're not trying to be pretty. It's yeah, and wherever you're wind up at, that's gonna be it. But you're really sealing the ears, so you should only hear this humming in your head. You ready? Okay. We're gonna do 3. And so if you're the last one humming, well, I'll listen, just kidding. I'll try to be the last one. Okay, inhale. And begin. Keep going at your own pace. Inhale. The more you seal the ears off, the more you get that bee effect in the head. One more. Inhale. And hum. All right. Good job. It's actually surprisingly, it sounds counterintuitive to me, but it's can be very helpful for anxiety. It can help migraines. It can help. There's kind of a list of concentration and memory, because what you're in a weird way, it's like pratyahara, and you're building this almost intense single focus through that sound that becomes almost like, I'm a very visual person. So to me, that sound almost becomes like this line, this pointed focus. It does calm the nervous system. Yeah. It can help in reducing blood pressure, building confidence. It's used for all kinds of things in yoga. Of course, you're not going to say, I'm going to give you this for your blood pressure and get off your medicine. That's another thing, by the way. Never say it like anything that's not supportive of what they're doing in their other modalities. We do not. That's a whole other thing. Okay. Good. All right. Let's do some work. So I'm going to have you in groups. And I wrote this down because I knew we're going to, it's finding where I wrote it down, that was the issue. Well, we're doing 4 groups. You 2 will be one group. I think it's just easy. It's just, you'll be kind of a small group, but that'll be fine. And then everyone else in here, let's number off 1 to 3, and you'll be in a group, I think, of either 3 or 4 people. So if you'll start, please, Adam.
1, 2,
3,
1, 2, 3, 1, 2, 3.
1. I'm too.
That was great. Ryan's like, I'm ready. All right, so you're either in group 1, 2, or 3, or our online group. And group 1, you will do, and before we go into it, I will tell you how to do this and what you'll be doing, but you're going to fill out the next one, which is yoga for depression. Group 2, the one after that is yoga for insomnia. Group, and I'll tell you how, don't worry, because you might be thinking, well, how? Group 3, you're going to do addiction recovery. And your group 4, and you get to pick one of any, even anxiety, and you get to pick one. And what I love about this is we're going to see how there's a lot of right. I want you all to hear this. There are a lot of right ways to do this. Okay. So you get to pick. Now, how you'll do this is it's usually easiest if it's one of you, but you could all decide it as a group. But you go through and you kind of do like you're doing an intake form. And you go through and then if you need any follow-up questions, you do that. But if I'm in a group with you and you're going to be the person, you get to come up with all the answers. And it's usually just easier if it's one person, but however you want to do it, this is your person with depression. The thing I want to say about addiction, we want them to be 6 weeks out, unless it's something like smoking, caffeine. It's just with the more hardcore, and not that they're not all mind altering, but there's some like alcoholism and a lot of drugs are just, it's so hard that, it can actually be more stressful for them to try to do something like this than no, 6 weeks, I'm sorry.
Oh, 6 weeks.
Of sober, yeah. But if they're like a chain smoker who wants support, that's someone you can get right into the heart. It doesn't mean there's not a place for yoga for addiction for those folks who are like suffering from alcoholism and things like that and are in the throes of it. It just means that it's probably beyond the scope of what you want to take on and what I would advise without very specific training. So yeah, that's all I'm going to say about that is you get to decide. Maybe they're addicted, like I'm doing this digital detox because everyone's addicted to their phone and their media, and they're like, when's the last time you just sat in silence that didn't have someone else's thoughts intruding on yours, kind of thing. You get to pick what's the thing. Okay. And you're just gonna, and then you'll go through as a group and you'll fill this out. You'll come up with a little sadhana and we'll share them. Sound good? So it's 12:03. I'm here for you, but I'll check in at like 12:30 and see where you are. Don't be too precious, meaning perfectionistic. Like it kind of go a little with like, oh, this will work with this and this and this. Like kind of get those muscles going. Okay. Good? Okay. Now you all, I am going to mute myself and I'm going to turn down the volume. I'm going to keep checking in though. So if you need me, put a note in there, or if you see me looking at you, wave. It's just hard to manage that because I can't leave your, I guess I could leave the volume on for, I'll figure it out. You go ahead, get to work.
Thank you, Amber. I'm actually going to use the restroom real quick, Lori.
Excuse me. I want to just say that I thought your pranayama was great.
Oh,
It did
thank
not
you.
seem to me like you were teaching it to yourself, which
Oh,
Rebecca's comment, I didn't feel like that. So,
I could see what she meant though, because I really was like, okay, I'm gonna lay it all out so that I don't forget anything and then walk people through it. So she might have been like catching on to the really
how else
subtlety
can
of
you
it.
do it at this point? I mean, I'm gonna have like a million notes, and I
I know,
I think
I
I
was so
do it
glad to have
next
my
one.
notes. Yeah. Good luck.
I'm freaking out about it already.
Oh, you'll do great. It goes by pretty quickly too. I also wanted to say I love working with you. I think it's so awesome that we get to work
Oh,
together
I
all the
love it
time.
too. Although it would be nice to work with other groups too, don't you think?
To get some ideas, yeah.
But if I had to work with only one person, I'm loving working with you.
Yeah, me
So
too. Is there any like the depression or anxiety or insomnia or addiction? Is any of that calling out to you?
um I nothing, there's nothing that's like really, I mean, anxiety appeals to me just because I have anxiety, but I any of them. Insomnia would be interesting, maybe.
Yeah, I like insomnia. Let's do that one.
Okay. How long did she say? I was already like looking through my notes and I didn't hear, I wasn't listening very well.
No, yeah, she said she'll check in at 12:30 for them.
12:30. Okay. I'm also not really good yet on the values.
Me neither. I will need to keep flipping back and forth pages to see which one's which
Yeah.
and the koshas.
And the coach.
Yeah.
Oh man. And my book
Okay.
is not like pages aren't numbered and they don't have the section numbers on them. I can't find anything in here.
That's the part that makes it hard for me is that there's no page numbers. It's do you need help finding the models for the values?
Well, if I look at the, where was that? Yeah. What does it come after? Because
It's 6.3.
okay. So after the private sessions. I need to put just like tabs on here.
I
Okay.
just started doing that. Yep. Little
Good.
stickies.
I'm going to do that before next month. Okay, I have the values. I kind of want to pull them out, but then I won't
It'll
remember.
get mixed
I'll
up.
Stick it back. I'm a hot mess.
That's me too.
I'm hot too. I have the heater pointed at me. Okay.
Oh,
All right.
yeah, get comfortable.
Then we're gonna
Okay,
flip that.
so
Okay, are you
I
gonna
think-
use your little, the sheet that,
oh yeah, to fill it out, the yoga for insomnia.
well, yeah, and then they gave us the worksheet, the handout. Did you print that out?
Oh, I did not put that
Just
on
like
yet,
to
no.
work with our private clients, but
Yeah, let
Anyway.
me see. I can pull it up too while we think about the Anamaya kosha. Insomnia. I'm guessing, I mean, so are we making up someone or are we choosing someone as an example?
Well, I think, what was she saying? To use, one of us uses the other as an example? Let's just make somebody up.
Yeah. I mean, my husband gets insomnia sometimes. It's not all the time, but like when he's stressed out with
Oh.
work.
Uh-huh.
So that
Yeah,
could
let's
work.
do
We
that.
can try
Let's
that
do
one.
that. Go get him.
Okay. Yeah. Get in here.
Surprise.
Right. So I guess with Anamaya, how it would look physically. So awake in the evening and like he would fall asleep and then wake up at like midnight and not be able to fall back asleep.
Oh boy, I know that.
So
I know that so well.
yeah. So
When I was
waking up
working.
after fall. Oh gee.
So not being able to fall back to sleep.
Mm-hmm. I had pregnancy insomnia, so that was fun.
Oh, is that a hormonal thing or just like your thoughts of the baby and all that?
Both? I don't know. There's like really no explanation for those kinds of things, I think. Just like it just
Yeah.
happens and happens to be a common symptom too. Um, so maybe practices to consider. So that's the anamaya. So being like tired during the day, I think would be what it is, and like also stressed out a little bit.
Under Anamaya,
Yes.
kind of frazzled.
Looking at her yoga for anxiety notes. Okay.
And maybe tired. Oh, you said tired.
I'm
Yeah,
sorry,
yeah.
I want to interrupt everyone too. I don't think I was clear, and this is fine if you're doing it as if it's actually you, but it's also just you're making up you're imagining you're that client. Yeah. Okay, I didn't know if I was, I got worried. That's all. Pretend. Yeah, okay, just making sure. All of a sudden I had a worry. Okay.
Okay, so it would, yeah, be the physical. The physical would be tired. I guess maybe like it would present maybe as like dark circles under the eyes, that kind of thing.
Mhm. Like no energy.
Yeah,
let's
but yeah,
see,
but that would be
tired.
like the pranamaya, I think.
Ah,
So that would be low, no energy. But then too much energy at nighttime. So no energy during the day.
when the energy that he does have is more like not good energy. It's more like frantic or
Yes, frantic.
frazzled,
Yeah.
almost running on
Wor-
adrenaline.
yeah, and I think that that would be really good in the Manomaya is like fears and worries are like consuming or like stresses and things like that. For the Manomaya kosha notes,
Mhm.
that's the fears and the anxieties and the worries.
The monkey mind.
Oh yeah. I have to do this, I have to do that.
Oh my gosh. So before I moved out here and I worked full time, I did that all the time. I just thought my dreams were about work all the time and just like would wake up in the night thinking about it, and it was horrible.
It's like what you fall asleep thinking about, and the first thing you think about as soon as you wake up,
And I
and
sleep
just
that during sleep. They weren't like real dreams. It was like I was playing over in my mind all night. Ugh.
that's exactly what my husband will do too. He has dreams about work.
So just tell him to retire because that all went away the minute I stopped working. Easy.
Yeah, totally easy. It won't take another 20, 30 years.
There's advantages to being older, I guess. There's disadvantages too.
Yeah,
So
pros and cons to both. So I think for the Vijnana Maya, workaholic would be the right
wisdom thief. So
discernment. So like, yeah, workaholic, like focus too much on work, or like the attachment to work or something like that.
yeah, and I like focus. That's good too. Focus,
Mm-hmm.
attachment, intellectual thought,
Mm-hmm.
wisdom. That's
Like focused on like the outcomes of work, or
and thinking about it, just thoughts about it all the time.
yeah, and like how like when you're attached to something, you're confusing your identity with it, like you are the worker.
Yeah. What about, does he feel like overly responsible for something there? Is he a
Oh,
manager or
definitely.
something?
Yeah. Yeah, because it's also the weight of like supporting family on top of that weight.
Yeah. He does,
Oh.
he maybe looking at like not trusting his his inner self or his intuition.
Yeah, yeah, that could be part of it because like waking up and like thinking things over and over and over could be like second guessing type.
Ah,
Maybe does that fit into the Vijnana, do you think, or the Manomaya?
well, in my notes under Vijnana, I have the dis-ease, the is like poor choices, no intuition or trust in self, lack of higher truth. Because the wisdom is about not like knowledge, but that our inner self knowledge.
Mm-hmm.
I think deep knowing and insight.
Deep understanding. Yeah. Yeah. So it would be like not trusting your intuition and not having like a deep comfort understanding that it's all going to work out.
Yeah. Or maybe he's not in the right job.
Yeah. Yeah.
I hope his
Now he
ears
likes
aren't
his,
burning right now.
no.
Were you talking
Now,
about me?
now it's turning over into a fictional, my husband, because he,
Yeah,
he
this
loves
is
his job so much. Yeah.
yeah, this is not your husband.
This would be him if he didn't take care of himself and didn't work on these things, I
Yeah,
think. Yeah.
this could actually apply to a lot of people.
I'm sorry to
Oh, I
interrupt.
think so.
How are you doing? Do you think, my question actually is, do you think at 12:30 you'll be able to have a little mini sadhana? Oh,
We have.
I think so. Yeah. 12:30, maybe 12:35.
12:30.
Yeah, we can do 12:30.
Yes.
Are you
we will.
negotiating? 12:35. I like by 12:30, but don't worry about it being perfect. Just have something where it's like, here's a 10-minute or 15-minute thing we would do for this
Okay.
person. Okay.
Okay, got it.
Okay,
Okay.
I'm gonna go quickly through
I know.
Nandamaya. Have we been doing the right side of this column? Yeah.
Yes, and now to the left side. Gosh, because I guess I feel like this could take forever if you're doing it on your own and like doing it with a client. So movement to consider or practices to consider for waking up and not falling back asleep.
Did we do something for Anandamaya?
Anandamaya, I put doesn't trust self and like doesn't trust
Oh,
that things are working out. Yeah.
okay. Okay. Practice.
Let's see.
I would say, like breathing, is that under Anandamaya?
Yeah. Well, yeah, I think breathing could be in any of them, I think. Can't I? Oh, maybe not. In all her other examples, it's mostly movements. So maybe like a like yin type or restorative, maybe like a restorative child's pose. Or feeling tired and stressed, so or do we want to counter that?
Well, maybe should we do the values first?
Um,
And then,
yeah, we can do it. And then practices to consider.
yeah,
Or
'cause we're under the,
values. So if he's stressed,
letting go is one, so maybe upon, he's not letting go of work when he's at night, when so Apana is pretty high. So we
uh,
don't-
is it high or is it too low?
Oh,
I'm confused on that
that's
one.
right,
Yeah.
that's true, it'd be, because he's not, if he's letting go of everything, it would be too high. If he's not
Yeah,
thinking
yeah,
about
yeah.
anything, okay. Feeling very stressed right now about getting this done.
I know, me too. Very, very Viana and Udana about it. Apana is low.
Prana's low, right?
I think
Okay.
Prana would be low, yeah. Maybe like a 1 or 2, and then
Seems like his energy is very outward moving.
yes.
So
So
that's,
Yana would be high.
yeah, so we don't want to work on that one.
Hmm. And then maybe Samana is low as well.
Absorption, consolidation. I guess,
And
I'm
then
not sure.
I think
Samana's
high Udana because the stress, right?
governs growth, speech.
Like too upward moving, too worried about work that like
Mhm.
getting those things moving.
Yeah, forward movement. Oh, Udana, speech, expression. So that would be high.
Hmm.
So what we want to address is Apana and Prana.
Yes. Yeah, that sounds good.
Oh, maybe we said Samana was high,
I think Samana is lower,
low.
like middle maybe. Lower or middle, like 2, I thought. Because it's like 1 to 5, I think.
Oh, so should we
and
focus
then
on? Okay,
oh,
go ahead.
no, what did you say?
I was just gonna say, should we focus on Prana and Apana? As since they're lower?
Yes, I think so, yeah. Yeah. And maybe some Samana too.
Okay.
So maybe movement to consider if they're on a Maya. Wow, this is hard. Maybe like restorative child's pose. What do you think?
For Anna Maya?
Yeah.
Yeah.
All right, just a little over 5 minutes.
Got it.
And maybe some grounding.
Yes. What was the one with the
Was-
2 fingers on the ground?
Mudra.
Bhumudra. That's pretty good there. There's one, the Pranamaya. Maybe a double down breath.
Yeah, that's good.
Or Ujjayi breath as well.
Let's do Ujjayi.
Okay.
I didn't ever really think about that as being relaxing.
I know, right? Just do it during a vinyasa usually. To like bring
When you-
energy to the practice.
Right. Can you do Bhu Mudra and Ujjayi breath at the same time?
Oh, I don't see why not. Yeah.
Purnamaya. Oh, that was-
Yeah, that'll be the Ujjayi breath. And then for Manomaya, fear, anxieties, worries, maybe giving a mantra like, or even just an affirmation of like not this too shall pass, but like I know what I'm doing and I'll get it done or something. I don't know.
I trust myself.
That's a good one. Yeah.
Or kind of covers everything.
Yeah.
Jnanamaya.
Meditation, a chant.
Mm.
It could be like so hum or no. Ata maybe, because like keeping in the present moment, like I don't need to worry about that right now. I just need to be right here. So like Ata
That's-
could be a
That's good. That's really good.
and then
You have 3 minutes. Jnanamaya.
I think Yoga Nidra for the Anandamaya,
Ooh.
because that'll put lots of people to sleep.
Yes. So how do we want to, the dominant guna is 2 rajas?
I think so, yeah.
I don't know about practices, all these other practices.
Yeah, I just used what we suggested and then
Okay.
yeah, I don't mind presenting either because I wrote it all down in the how will you meet the client's energy, then shift it. Oh, wait, so how will we meet the client's energy? We're going to, I think it would be great is giving them a vinyasa flow, like a 15-minute, just because they're already like there, and like giving the one breath, one movement will keep that flow going. And then perhaps having them shift from a yin to a vin, or vinyasa to yin.
Vinyasa to yin.
Yeah, like maybe like start the practice as a vinyasa and then end with more yin poses.
Except I think we might want to like make it a third of that. Like
Right.
maybe 1 vinyasa pose. And a yin
1 minute.
pose. Start with Bhu Mudra. Then do the Atta chant. Then a vinyasa pose.
Yeah, or like a small flow, like a 2 or 3 minute like sun A or something.
What was Bhu Mudra? And we were going to do Ujjayi breathing.
Yeah.
Okay. Then a Vin flow. What was which flow was it?
Which flow was it?
Yeah.
The sun
okay.
A?
Sun A. We go into
Okay. So wherever you're at, it's okay if it's not done. May I have your attention, please? So wherever you're at, and I realize not everyone's completely done, that's okay. You have something though, right? And that's all. What really matters is you went through this exercise. We will go around and you'll do a little presentation. Here's what we have time for and what we don't have time for. So we have time for you to give a really brief overview of the person. Don't give away too much though, because we want to hear your sadhana and I want everyone else, we're going to do it kind of a little game, I guess. I want you to be actively listening and critically thinking and going, which values are they trying to strengthen? This will be a good exercise for you as a listener to try to figure that out. So don't tell us about the values, don't go into too much detail, just broad overview of the person and what you're giving them. Sound good? Okay. Let's do it then. I would like, are you two good to start us out or do you want to wait until last? I'll give you a choice, first or last.
I like going first.
That good? Okay. So let me get you turned around and get my volume up nice and loud here. Okay, try to get as many people for you to look at in there as I can.
Okay, Lori, please feel free to jump in. But the overview of the person, we chose a fictional my husband. He will have insomnia. He'll wake up in the middle of the night thinking about work and get stuck in that loop. So what we decided to give the client and meet the client's energy at with is giving him a very short vinyasa flow, maybe like a sun A, one or two rounds of that, and then giving him a couple yin poses to go into, one or two, and then ending the practice in the sadhana with Bu Mudra with an Ujjayi breath for a few minutes, and perhaps giving him Atha as a mantra, and then I'm just gonna throw this in there like a weekly yoga nidra.
Yeah, you can do like, yeah, little extra things where it's like once a week, do this. Fantastic job. What did you all notice value-wise?
They are trying to strengthen Apana.
Strengthening Apana, is that correct? Yeah, what was I had one that was a big clue, but what was yours?
The Bu Mudra.
Bu Mudra's kind
That was
of
the first one, and
yeah.
then the Nidra.
Nidra, yeah, and restorative poses generally have that feel to them. Anything else anyone noticed? Okay, was there anything else you thought needed for your client strengthening value-wise?
Prana.
Oh, prana. And say more about that. What made the prana week? I'm just curious.
Well, the fact that this person like wakes up and thinks about work and can't get back to sleep kind of keeps them from moving forward
Ah,
and stuck. And so we thought that was
okay.
prana.
And that what's interesting about what you chose to do, and this happens sometimes, you get ones that seem like they should make the other one, they shouldn't both be weak, and they seem like they need different things. Prana needs something quite different than Apana, right? But if you're seeing both of them and that vinyasa kind of gets some of the prana going, and what else did you do for prana? Were there specific poses?
We didn't get that far.
Yeah.
And I think that was also some of the Atha, that like being here now versus like worrying about later.
Good. I'm not 100% convinced that that would be prana. It's not that you're wrong. And here's the thing, you're not going to hurt them by trying it. Prana moves forward. Being here now is more of a apana.
Mm.
You see what I mean? Can you kind of see that difference there? But you know, also like I know you didn't really get to list your restorative poses, but you can do a restorative heart opener. Restorative bridge is fantastic, and that could be a way to address both in one pose. So yeah, good job. And I like the weekly nidra too. You just can't go wrong with a good yoga nidra. I heard another group mention you can give them YouTube. Also, Insight Timer has lots of free nidras that aren't gonna have ads or things like that. Okay, great job. Let's give them a hand. Thank you for kicking it off. Who would like to go next? Yeah? All right.
So for ours, we had a client with insomnia. Can you guys hear? All right, Lori and Mark. Okay. We had a client with insomnia, female client going through menopause and anxiety when she's sleeping. Or or she's trying to go to sleep. So we ended up creating the sadhana for insomnia. So a little more restorative at the beginning, starting with a supported child's pose, taking time to tune in and call to mind a sankalpa, or if they were working with us before and couldn't think of a sankalpa, then just finding a kind of an intention or a affirmation that they can tell themselves, like I will focus on rest or something along those lines. And then we decided to put in some gentle movements, some earth salutations. If anyone's familiar with these, you inhale, hands to heart center, and exhale, arms out in front of you. Inhale, arms up, and then exhale, Bhu Mudra down to your sides. So can repeat that for a few rounds, and then finding your way down to the back and doing a legs up the wall, and then ending that off with yoga nidra. Well, before that, actually doing a Langana breathing. And then if we had kept going, then we were planning to make more of a longer one or a more invigorating one that you can do during the daytime, and then one that would probably incorporate a little more breath, like maybe Nadi Shuddhi as well.
Okay, good job. Now, is this, and I'm sorry if you said this and I missed it, is this for if she wakes up and can't get back to sleep, or is this just a nightly routine before that?
This is like a nightly routine before bed, but it could work for that too.
Okay, good job. And what all did the rest of you notice about Vayus? And Lori or Mari, if you want to say anything, just during any of this, just unmute yourself. Was that? Are you trying to strengthen Samana?
Maybe unintentionally.
Wasn't like the main one that we were
No,
going for, but it was in there.
Um,
Yeah, we did that was one of, or
Mainly it was up.
it was Apana mostly, but secondary was either prana or samana. Or
Okay.
was it that? Yeah.
Yeah, so, and that's interesting that you wound up with, I mean, Apana, you will see a lot of with insomnia. That's just gonna make sense, but it's interesting, both groups had prana, because you don't always see that with it, but you can. Yeah, just really nice job. It made, it makes sense. And one thing I wanted to say about the earth salutations, moving, the lovely thing about vinyasa for an anxious or nervous mind, which often is connected with insomnia, not always, but is just right. We're getting the physical to work with the prana. And once those start to coordinate, then the mind, what affects the mind? Have you heard where the breath goes, the mind goes? So then, like, if we can kind of give the body the movement it needs, coordinate it with breath. So it can be actually a very simple, gentle movements like that can work great. So fantastic job. Good job, everyone. I would like to give you a little hint on insomnia that you would not have any other way of knowing this, but just from working with lots of people with insomnia and having a little bit, I'm not an Ayurvedic practitioner, but there tends to be two kinds in Ayurveda, which is related to yoga. There's hot insomnia. So in this, it's very like they wake up and they problem solve. They're thinking about, like you said, like their work and what are they going to do and what's going to happen. And that's a heated one. So we also want to think about kind of prana makes sense because it's an opening. It's a kind of releasing, cool. You can feel how that's almost kind of cooling versus like really strong samana is going to be more heating. The other kind of insomnia is more, they'd call it more vada, but it's a very cool bing, 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 not really problem solving, but just thinking about, and then today I saw a dog, and then yesterday I saw another dog. And then remember that time I looked through the window and like just like a pinball machine. And that is actually going to need a little more warmth. So when you see that, so it is, I want to just add this to your toolbox, I guess. If you have someone with insomnia, ask them what is going on in their brain.
So what would you recommend for the Vata insomnia?
Probably Samana, but by the way, Apana is going to help either one too. Generally, I don't know of any situation where Apana isn't going to be a big part of insomnia, strengthening that Apana.
That was the other thing I noticed, and like you said, there's nothing wrong, it's all right. But everything can go anywhere.
It could, but it won't, because you're also not going to pick, but it can't go anywhere. I disagree. To an extent, I see within the confines of the Vayus and the koshas, but you're not gonna come up with a real exhilarating practice that incorporates jumping jacks and things, right? So what I love is each group did different things, but they both could be very effective. And that's what you'll see when you do your group check-ins. Which, by the way, before we leave for lunch, remind me to tell you how to prepare for your tiny little presentation next month. It's nothing to stress about. All right, who wants to talk? Thank you.
And did you have? Which one did you have?
We had addiction.
Addiction, okay.
So we had addiction. And our person is addicted to like electronics or like a virtual reality need. So constantly need to be on their phone or distracted with electronics, something virtual. And our sadhana would incorporate movement first, starting with things like extended mountain, some joint freeing things for their shoulders, maybe their wrists, with some gentle twists, and then possibly working in some very easy core building or just mula bandha work. And we would have them try to work on a drishti that is upwards or horizon focused. Moving them down into either like a sphinx pose, maybe a crocodile pose to do belly breathing exercises. And then coming into maybe like some body scanning. And having compassion-based mantras, Aham Primal. And then something that would be extra outside maybe their sadhana practice, having a daily log to help bring them into some self-reflective practices. And I'm missing things.
I think you had, I mean, it was mainly like somebody who's
Oh, and getting them out in nature as well.
telling them back to reality. What can we do to replace the escapism?
Mhm.
They may not know what they need, what brings them, because we thought about Ananda Maya, they may not know what brings them bliss other than just chasing the dopamine. So start with the little things, maybe get them out in nature, start with journaling, and then maybe they can understand their underlying virtues, what brings them happiness, where to go from there, and then building it up.
Mhm.
They're building up their practice from there.
Yeah, fantastic job. So before I comment
you,
or say anything,
Melissa.
what Vayu is weak for this person? Samana? Why do you say Samana? Sorry, I know.
There was a lot of self-reflection, so I think there's a lot of, inward kind of directed movements or something like.
Yeah, inward directed movement, self-reflection. Is this correct?
I would agree. I think at times we also see
Yeah, no, they're on higher self.
And you just wanna open up.
Open up also, but
Yeah,
is,
they're
but is
cautious.
Udana already weak for them? Is the question. That's what you have to ask and see, look at what the information you have, not trying to logic it out. You know what I mean? Is Udana week?
would probably be a little bit weak,
It
because
could
we
be.
have
I'm
to
not
do
arguing
something.
saying it's not. I'm just saying make sure.
Good question though, because I think my, logic brain wants to check a box like that, but it's not quite so black and white.
Yeah, it's not always, and it's, it's one of those two where if you're not sure, just pick the one you're sure about too. You can always just do that. I mean, there's gonna be plenty to do with that, but that's fantastic. And I do think too, I like, you started with movement vinyasa, am I right? And this is again, a great example of meeting them where they're at, because when someone's getting that dopamine, just going for the dopamine hits, think of, I mean, we talked about this last month, but think about what that is doing to the chitta to just be, I mean, think about looking at one post in social media or one potential thing to watch on YouTube or whatever, and the millions of thoughts it could bring up. If not millions, okay, maybe hundreds, but like just seeing the picture, the colors, the words. I mean, it's just the mind is going like, so there is that really strong V on a, we need to meet it and bring it in and get single pointed, because two, it's, we know technology is making us too Viana. It's destroying our attention and Samana's attention. So yeah, great job. Did we clap for the last group? All right, do a double. Okay. Last but not least, and what I love about these, every single one I'm hearing, I'm like, this is gonna be good. The client will benefit from this. All right, who's gonna talk? You'll be my video person? Thank you.
Okay, so our client is suffering from depression, and symptoms are like brain fog and ability to focus. This person says it really starts with anxiety in their stomach and then kind of spirals up into depression. And so our sadhana was 15 minutes of personal practice, ideally 3 times a week, starting with the Sankalpa. Moving into Sun A for movement, so 3 rounds of Sun A, coming up into extended mountain pose, down into the forward folds, high, and then also incorporating tree, malasana squat, and child's pose, and the movements.
Mhm.
Yeah.
I really want to hear what you have to say.
So sorry to interrupt. I was just gonna pull all that iPad stuff into the other
Yes.
space so that.
What do
don't
I
have to
have that you need here?
Interrupt later or anything. I have that.
Oh, okay.
Yeah.
Where's the?
Pause for a brief intermission.
Pause.
iPad. Speaking of technology.
Thank you. Sorry to
Oh,
interrupt.
and it doesn't, no.
No, not that one.
Well,
Okay.
I don't think it'll, what does that look like? Oh, it needs a little, needs the thingy. Okay.
Okay.
The thingy mabobber.
I'm glad she knows.
Yeah. Thank you. Sorry to interrupt.
Thanks, Morgan. Okay.
Okay, so Sankalpa, Sun A's 3 rounds,
Okay.
incorporating Sri Malasana child's pose as well. Also pulling in the Ujjayi breath, focusing on the Ujjayi breath as this person is working through the postures. Incorporating some meditation with a mudra, so Soham with Bu Mudra, and then ending with a Sankalpa. We also recommended this client do a 60-minute asana practice 2 times a week. And then the other thing that we recommended was some just daily coping techniques throughout the day, because this client talked about just really kind of being triggered at work. And so some of the daily coping techniques throughout the day would just be a couple of rounds of that Sun A going, up and then down, and also some Shitali breathing, like if they had to go into the restroom or something and just take a couple of breaths to kind of cool down.
I love those little life tips that we can give too, like when you are at work, go in the bathroom and do this. Yeah, okay, fantastic job. And okay, what was the value? The one you noticed? Prana?
We didn't say prana.
You think Apana's weak?
Well, it seemed like they had some grounding in there.
They did. That was interesting.
So we thought that so Udana was the main value. That's why with the extended mountains and things like that. And then we also thought Samana was
Samana,
which was kind of going more into the Malasana and
The
and
child's
child's
pose.
pose,
What was the Boo Mudra for?
just for grounding.
The grounding, from the Soham. To feel that connection with the earth, because the
Gotcha.
person said they enjoyed nature and they feel better when they're outside. And they also like have a sense of like not being able to open up to others. So that sense of I belong to this earth feeling was the intention. And the anxiety exhibited it in the gut, and it went up to the Uddiyana. So that's why we were attacking those two while grounding and increasing the breath.
Yeah, okay, thank you. Sometimes I have to ask when it's not just like immediately apparent. I just have to
Yes.
ask questions and you've got good reasoning behind it. So
Mhm.
yeah, great job. I think that's a great, my only thing I would say to consider, so first off, I do love I love giving them the little tips and do these extra things. Those can be so supportive. And I think that that's a really appropriate, I like the tree pose and the, Malasana, and it all makes sense to me. I will say I would be if they're doing that, how many times a week? Was that 3 or 4?
We were thinking 3 times
Three
a
15
week for
minute.
their 15-minute personal practice.
The
3 times a
devotional
week.
practice is connecting with community. She already stated that she was in a yoga. She enjoyed the yoga community. It helped her ground.
Okay, so
and
that's
feel
why you
like a
wanna get her to
belonging.
yoga also.
Yes.
Okay.
It was already part of her practice, so just encouraging that
Okay.
consistency.
Yeah, and if she's already doing yoga 2 times a week isn't probably a big stretch. If it's someone
Who doesn't?
Who doesn't?
or who does, but just is it's hard for them to get in that. Just be careful with cause adding 2 hours to the week.
Plus the 15 minutes,
Plus
3 times
that,
a week.
yeah, it can
Yeah.
be, that could be overwhelming to the point of either getting depressed, like I can't move, I can't do it, or. I mean, sometimes anxiety and depression is just that loop, right, too. So-
Well, we also got, well, you didn't ask this question yet, but we discovered the inverse guna situation.
Yeah,
So, because she functions from she's tamasic, but she functions outwardly, she looks rajastic. And
okay,
so that, since that can be very unclear to people that are viewing that person.
yeah,
'Cause they're like, oh, she's got all this energy, she's getting all these things done, but internally you could just be crippled. And it's the functioning the present.
yeah, great, good thinking all the way around. Well, good job, thank you, that was great. I just, again, all of these are, what I'm hoping you're seeing is like I said before, there's a lot of right ways to do these things. And if you get in there and you're like, oh, that didn't work, that's okay too, because that's a lesson, but it's not going to break someone. Say you gave them like the earth salutation stuff, say you gave them that and it was not helpful, that's not gonna harm them though, right? Like it's just you're gonna just, if you were to continue working with them, you just tune it up. All right, and first off, fist to 5, how are you feeling now about going in this month and working with a client? Fist is like 0 flat, and then all the way up to like, I'm excited, I'm ready. Okay. I hope it has improved throughout the day and that you feel some confidence. Remember, you don't even have to, sometimes it's hard to have confidence in yourself at first, so have it in yoga. But also you've done some amazing learning and work and you're ready for this. No one would send you out to work with people if there was any harm you were gonna do, right? So you can do this. I do want to say 2 things before we head out. And I want to take any questions. So first thing, I don't know if I mentioned this last month. I do want to just say, of course, use their faith. So when we talk about Anandamaya, and we kind of touched on that a little in the conversation, but like really, if they're Catholic and it does a lot for them to say the rosary at night or whatever, then give them the rosary as part of the whole of the thing. Really think about ways to personalize it in that way. Another little thing is if you find something online or in a book or an article or whatever that's like yoga for grief or yoga for depression, this or that, you can use it, but make sure, does it fit for your client? So again, don't worry about the label, go use your critical thinking and go, what guna, what vayu, what kosha is this working on? And is that what my client needs? Rather than just, this is yoga for everyone's grief kind of thing. Okay. I want to point out the group presentation. This is on section 5.1. I don't have the page in front of me. I'm sorry. I don't even know if you need to look at it. Just know that it's there so that you can be prepared. You're only going to have 5 to 7 minutes. It's short. Actually, Erica De La Quadra will be with you that night. She did an internship to teach this section last year, so she's ready to go. And she will lead that. I do want to just say, you need to just give an overview, kind of like you just did, of your client. There just won't be time for the nitty-gritty detail, even though that's actually really interesting and I know we would all like it. What did you give them for the sadhana? How'd the follow-up go? And here's a really important thing. What is your biggest takeaway from the assignment? So just make sure you've thought this through and that you don't just come in and ramble for 10 minutes. And that you put a little, don't make this too hard, but also put a little thought into it.
Is the meeting with your mentor, you said, or the actual client? What did you discover during your meeting?
I'm sorry, with
Number 2. Kind of
the client.
Okay.
Mhm. But you could also put your mentor, if that is something that really changed the game for you or really made you see things in a different way, certainly. Just make sure you're kind of in that time frame. So you did a whole heck of a lot this morning. What questions do you have?
Client as well with their representation, or we're just going off of like check-in, go. What we saw.
The
Like, would it be straight up be able to ask them when you do this or you know?
That is part of what you want to do for your check-in. Yeah, good question. When you meet with your client or talk to them for the check-in, it is literally, did this serve you? What worked for you? What didn't? Encourage them to be really honest about what they did or didn't do, because if they feel like they need to be dishonest and tell you they did the whole thing, but then you don't know that, but then you get these results that don't matter. Because if they're like, well, I did it, but it didn't really work, but they didn't really do it, then of course it didn't really work. So it's nothing for you to, you can't really learn from that. So encourage, I really do need to know exactly kind of what you did or didn't do, and there's no wrong.
Is there a second client August, then in September would be due for the second presentation?
I don't have that in front of me.
Okay, this is really different.
It's in the very next, it's right after yoga or it's actually before it, I think, yoga for, it'll be in your homework and is it 5.2? And it has this timeline, has the timeline for when things are due.
Mhm.
Yeah. Did you see that? Are you
I
good?
was on the back.
Oh, okay. Are you too good at home? Did you see that? Okay. Any other questions before we go to lunch? Go eat then. I'll see you. We'll do Gita in about an hour. Please be awake for me. We'll be back in an hour. That's 2:00. Please be awake for me because Gita after lunch. Oh. All right, we'll see you all in a little bit. I'm gonna stop this one down or shut it down and I'll start it up again.